presentation is 10 minutes. Is that right?
Yeah, that's correct.
Okay. Just I'm going to have my stopwatch.
Ritsuko Sensei, can you understand Japanese? Okay, sorry.
Thank you so much. It's my honor to be with such esteemed colleagues from all over the world. Amazing work that you guys are doing. Nicole and your team and the clubs, just really impressive what you're doing. I'm going to go ahead and share my screen to start that. It's my honor to be with you all. Professor Yoko Kato, thank you for having us. Nicole presented me. My role is really more related to the Institute of Neurosurgery now rather than the department as she presented, but it is great to be with you all, okay? And because we have 10 minutes, I'm just gonna get right into it, and I'm going to present to you a very specific example of thinking of innovation to share my experience and in that example, okay? So for the students and residents on this talk, this is for example, a giant aneurysm. And historically in microsurgery, at least, we would do a bypass procedure that goes from the carotid to up here so we could occlude this here, okay? The way this historically has worked in the field of neurosurgery is what we call a high flow bypass, meaning we take a radial artery, so there'll be incision in the arm, and there'll be a radial artery about this long from here to here. So that would be the incision. And that artery would be attached to, so this is a common carotid artery, external carotid artery, internal carotid artery, attached somewhere here. And then it is tunneled all the way underneath, all the way inside the sylvian fissure to go here, okay? So this is the first opportunity for innovation. Long incision in the arm, long incision in the neck, and then this long graft going underneath, so a craniotomy and the neck incision. So as I was thinking about this, as I was growing up after my fellowship, so this is a middle fossa floor here, and I came to understanding that there is an artery here that comes like this and sits like this, the maxillary artery, okay? And I had done a number of these high flow bypasses, a large procedure, long graft, long tunneling, and I started to think, could we take a shorter graft, not as long an incision in the arm, attach it to the maxillary artery and bring it here and attach it here? What is the advantage of this thinking? Well, one is, you have these very long incisions that you can avoid. But the most important thing is that length of the graft is a huge issue in the physics of vascular surgery. The longer the graft, the higher risk of thrombosis. The shorter the graft, you have a better decreased risk of thrombosis. So not only you would have less shorter incisions, but this idea of a less invasive operation. The other principal problem that I want to bring to your attention is that at the end of this graft bypass, you would occlude the internal carotid artery permanently. Okay, so you still need an incision in the neck, although you're not attaching the graft here. But occluding a carotid artery on a patient is a big decision, at the end of surgery under general anesthesia. So these two problems posed a question for me how to handle it. So the first number one problem I talked to you about is the long incisions and the long graft. And I decided to go with something that could be a short graft and would avoid such a lengthy graft. So that was number one issue that I dealt with. And this was, became, this graft that we decided upon looking from above, going from the maxillary artery to the middle cerebral artery here, instead of going all the way from here to here. Okay. So this we published this, and I'm honored that a lot of vascular neurosurgeons around the world have named it for me. I'm actually humbled by that, more than honored, I must say, totally humbled by it. But so that's the idea. The second question that I pose to you is this, which is equally very important that I faced in neurosurgery. When you're doing this anastomosis here, okay, you're taking this graft, you're going to do a craniotomy, you're attaching it to a branch or to the middle cerebral artery. So you're attaching a graft to an artery here. So imagine this is M2, for example, and this is your radial artery graft coming in, okay? To do this procedure, you have to temporarily occlude this M2 during the anastomosis, while you're doing anastomosis. The problem we run into is that you don't really know 100% that this person is tolerating the occlusion of this artery well. The neurophysiological testing is good, but it's not perfect, and it has problems. That's number one. Number two is a bigger problem. At the end of that procedure, once you've done this graft, you have to permanently occlude the internal carotid artery forever. Remember, this patient's been used to this carotid artery, and permanently occluding it under general anesthesia. I used to have to pray. All of us pray before we do that, because you're hoping that your graft is working, everything is perfect, the patient is under general anesthesia. So that is a huge step, and that's why if you look at the risk of high flow bypass in large series, it's not low. It's up to 20% morbidity and mortality. It's due to these two steps. Okay, so I thought, as I developed this, can you mute? As I developed some of this, as I started to do aneurysms awake, can we do this under awake setting so we could test these two critical steps without having to have those issues? Okay. So let me take you through this real quick. So this is a step-by-step of what these two things I'm just talking to you about. So, sure. So first, this is a maxillary artery here, okay? And I'm just gonna move this along. That's a maxillary artery there, okay? And we find that artery underneath the middle fossa. Now, how do we do the surgery? Well, this patient is not under general anesthesia. So this is under conscious sedation, okay? And so there is an incision made and this is under regional block. So a cranial incision, neck incision for occlusion of the graft. So that's a graft. Okay, first we're attaching the radial artery to the maxillary artery. That's not a problem because the maxillary artery does not supply the brain. So we're fine, we don't have to wake the patient up for this. That's a radial artery and the blood is coming into it here. Now, this is a first step. I'm going to attach it to this artery here. How am I going to know 100% that the patient is going to tolerate this very well? You see, I put the temporary clip on, and we're testing the patient for a few minutes before I commit. Once I commit, and I know the patient is tolerating, now I've had cases where the patient did not tolerate that. On awake testing, we went to another branch until I get the right branch. So this is the attachment right there. And I'm attaching the radial artery to them while I'm talking to the patient. Okay, great. Next, we confirm graft patency. And next is a bigger step, which is I'm going to In the past, traditionally, the way we do this right now is that we occlude the carotid artery under general anesthesia. I'm going to do a temporary occlusion test, okay? Temporarily occlude the internal carotid artery and do a 10-minute test, which we cannot do. I mean, there's no advantage of that under general anesthesia. I'm going to test the patient 10 minutes with a hypotensive challenge.
There was no hand, no tight. All right, there you go.
Okay.
Look at your toes, Deborah.
Okay.
Look at your toes.
So testing for 10 minutes.
Great.
Then when I know, you really will know in the first 2 minutes based on our data that's coming out in this. But I'm occluding the carotid permanently. I know the outcome of the patient 100%. Okay. That's a graft instead of going all the way from here to here. And the second step was awake. So, you know, we don't have time, but we published this data for the bypass. I compared myself to the literature in my first 30 awake cases. Significant difference in my own outcomes, how we went from stroke rate to halving it, going from mortality to zero mortality because of those 3 steps I showed you. So that is the kind of thinking about innovation from our standpoint. You know, this is the data that's coming out, the cumulative data of all of our awake cases under observation, significant difference, same team, same surgeons. This is not just bypass. This is all aneurysms and vascular malformations complex. We significantly decrease the morbidity and mortality in these patients, okay? So this was done under protocol. I don't have time to go through it. There are a lot of steps for patient consent, and this is the committee review of all the data on electronic health record over this period of time, and they're the ones who produce this data to us. So that is really how this data was achieved, and this is all going to be published. The committee just provided this data to us last year. So that's that. Last minute, I just want to say that for our colleagues around the world, students and residents, our research institute is a unique idea where neurosurgeons can serve as PIs. And it's important to say this with Professor Rutka with us here as well, with the major leaders in the world in charge of publications. Neurosurgeons have a very busy time and have small patient cohorts. We have developed a research institute where we will provide every neurosurgeon with a team of neurosurgery residents and students who will work on their clinical studies and put the data together. And these are groups of our students from around the world to develop multinational, multi-center, large clinical trials, okay? And we have a very sophisticated institute that looks at this. You know, we have IRB, we have every aspect of control over such large trials, looking at every center that's going to be involved. For neurosurgeons who want to be PIs and have an idea, this is your QR code. If you want to apply to be with us, a principal investigator, and we provide you with the teams that will do the projects. The teams are made of medical students and residents. For medical students who want to be part of a large clinical trial, this is your QR code here. For resident, this is your QR code. This is for the neurosurgeon. I hope we will produce, we will make our journals very proud in the future with very large multi-center, multinational research products under tremendous quality control that we have developed for this. And I hope a lot of the students and residents and neurosurgeons around the world will be part of this system with us. I hope all of you will join us for our Congress in Spain this September. It has been my honor. I'm trying to really fit my time here. It's my honor to be with you. And I'm honored, you know, Professor Cato for inviting me for this.
Thank you so much for your wonderful lecture, Dr. Salim. It's an honor and a pleasure to hear you as always, and your study that you have been doing this is really changing the face of medicine and is really making us have like a consciousness of innovation. And thank you, doctor, for your effort toward the education of medical students around the world. Dr. Cato, please, if you have some words.
Oh, thank you very much, Salim. So I think always your idea is very huge and great, and also the step by step. Now you including the medical student and the resident. I think it's very important because they're having our future. So we need to educate them. So we work together. I really appreciate your wonderful talk. Thank you very much. Thank you.
Thank you, Doctor. So moving on, now we have the second lecture of this first session. And please, Angelica is going to present Dr. Cato.
Yes.
Well, it's a pleasure to me to be here and present these grateful doctors. Well, now I'm going to present Dr. Yoko Kato. He is Associate Professor, Department of Neurosurgery, Fujita Health University, Board of Japan Neurological Society, member of the World Federation of Neurosurgery Societies, and chair of Asian Congress of Neurological Surgeons. Please, Dr. Yoko Kato, now we waiting your presentation.
Thank you very much. So my congratulations was Asian Medical Student and Resident Society for Neurosurgery and Dandy Club Bolivia and Spain webinar. And I heard the theme of this the webinar is the challenges in seeking a neurosurgery residency and beyond. That you can share your knowledge, and also you can promote your future career, I think. So today my talk is how to build the pipeline of the future neurosurgeons. So strong work ethics. So it's physical hard work and it's emotionally hard work. Strong work ethics is important in all field, and neurosurgery is no exception. So the surgical field is maybe I think that we need stronger than the physical physicians department, I think. So the Salim, he demonstrated high flow bypass. So this is just, I would show this is a recent amila image. So pre-operative, the planning is very much advancing now. 3D images before we can expect. So where is good the recipient, the vessels, and also where is the target bypass craniotomy, where we should open the bone. So the surgery, everything is become very less invasive. So minimally invasive for the patient, not only for the patient, but also the surgeons. So, but this is low flow bypass. Maybe the Salim, the before high flow bypass, maybe they can put the usual, the salvage, the SGMC bypass, I think, in case of the suddenly the ischemic has happened. So, but this is small the technique that you can practice every day, even anywhere at home, anytime at night. So I think everyday effort is very important. So I think maybe in the future, many of the vascular surgery can be replaced by the endovascular. So, but still, bypass surgery is some survive, I think, because it's very we cannot replace. Maybe in a far future, I think some drugs or some other idea will come up. So no more open surgery. Maybe you can no more chance to see the brain itself. So this is for the young neurosurgeon, the contribution and application, the knowledge to their hometown, the improvement of the surgical skills and the novel and new techniques to treat the patient in their region. So everything is reward to your local place, the patient. That's very important, I think. So highlight 5 quantities to be an excellent neurosurgeon is the motivation, honesty, willing to learn, the ability to problem solve, the ability to handle stress. So the qualities of the great neurosurgeon. So today's excellent, the guest speakers have everything. So the critical thinking and ability to control emotions, ability to do realistic self appraisal. So those things is very important, especially the team player. The teamwork is really important. So in Japan, we have a more increasing of the number of the nurse practitioner. So maybe the teamwork is very, very important. And also the research mind is another very important issue, such as evidence-based medicine, and also ACGME, and also that updates novel knowledge on the current or future practice. So you accumulate your knowledge besides your surgical skill as a neurosurgeon. And we need an overall training culture with faculty mentorship and provision of the time and resources for research activities. And the ethical issue for the neurosurgeon, good neurosurgeon, good person versus a good neurosurgeon. So this is 5 very important things. So deepening self-awareness, becoming a better influencer, and the leading with honesty, the improving coaching skill, and the developing emotional intelligence. So deepening self-awareness is just you can clarify the value, priorities, and the skills. Then you can understand the strengths and the weakness. So influencer is a strategy where vital specific behaviors are identified and changed to solve the problems. Understanding and adapting to working and relationship, the building. Honesty. So most important the qualities. So this is the adherence to fact, the fairness and the straightforwardness of the contact. So coach peers is a coach. So the listen activity and ask question for discovery. So the provoke the thinking, the shift perspective, and the check assumptions and the challenge beliefs. So emotional intelligence. So self awareness and the motivation, empathy, and the self regulation, the social skills. So those things is quite difficult to learn. So, but the unit very important as a neurosurgeon. So this is the Henry Marsh is a very famous doctor. Of course, everybody knows the Do No Harm stories of the life, death, and brain surgery. So I think the wish as a neurosurgeon we should very the deep think about the patient, the life. And this is everybody knows is the charity from Australia, and he treated the pianist. So who's supposed to be very short life, but after surgery, the pianist came to he sat in front of the piano just 2 weeks after the surgery. So I think it's we never give up. That's the very, very important. So the final maybe I don't have enough time. So the neurosurgery career versus family. So how you can balance for the two very important issues. But recently it's very increasing of the this solving this in the world, I think. So this is a male husband taking care of the child and also taking care of the house work, I think. So that just you can share the work in between the couples. So message to the student, if it were not for the efforts of these exceptionally strong individuals, the wings of the women in neurosurgery would not have advances to its present day status. So so every year I have a educational seminar for 5 days. So I invite about 50 doctors especially from the Asia. We hands-on and lectures, and also lectures, and also we invite them to the operation theater, and we watch the surgery, and also we teach from the beginning till the end. And this is a hands-on and a bypass hands-on, and also endoscopic, and also the clipping. And this is a CEA hands-on. So I think those activities are very important, and also among them that they can discuss each other. So they learned the neighbor countries, the situation of the neurosurgery. Okay. So this is my talk. Thank you very much. All the best wishes to your future career. Thank you very much. Thank you. Thank you very much. Thank you.
Raul. Thank you, dear Yoko, for the kind invitation, and it's a real pleasure to try to transmit to the students why neurosurgery is so fascinating. Let me try to share the screen. Wait a minute. Could you see it? Can you see the screen? Wait. So this is. Wait. Okay. So, of course, neurosurgery is something fascinating because it deals with the most complex and evoluted and important part of the body. But most of it is still unknown. And here we are dealing with something that is very hard to understand somehow how it works. Because it has two functions. It has the physical, we can deal with it like a mass, an organics, something, but we know, of course, that we have some functions that are really unique and very important for defining the personality. So neurosurgery is something that we deal with a physical and metaphysical world. And so it's very interesting and fascinating from a cultural and philosophical point of view. We have to study, we have to still and try to understand, and we are every day trying to shift from the physical part of the body and the metaphysical part of it. But also it's something where it's really difficult to deal with, because we are playing with the hard topics of life. We are playing with life and death, and so we can have during our job a strong and very intense emotions, in a good way when you save life, but also when you lose a patient, you will have a very important and sad emotions. And also, beside of life and death, we can seriously affect the quality of life of a patient, either on the personality or on the body functions. And so neurosurgery is mainly a matter of choice, and sometimes decisions are very tough and very difficult to deal with. But what is nice and what is fascinating of neurosurgery is that it is a matter of choice and a challenge. Neurosurgery is always a problem solving. So we have to deal with difficult problems. So the patient present us a problem, and we have to find the right solution for a complex problem. As Salem presented before, we can deal with very tough aneurysm, and for each one of them, we have to find the right solution for a complex problem. And the challenge is fascinating, is the amazing part of our job, and finding the right solution is the amazing part of our job. And in that, neurosurgeries have a very important support by technology. Every year, a new tool comes up and give us a new way to find a solution to solve a problem. And so we have technology has always been a valuable ally for a neurosurgeon. But if you see in the history how the imaging, for example, was several years ago, now you have a virtual reality, you have a reconstruction of all the brain and the function of the cartography, the function MRI, the 3D reconstruction of the lesion in the brainstem or whatever. This is something that give us every year a new tool to see the reality of the brain and to find the right solution for the patient. We have also new tools to play with. Now we are dealing with the exoscope, which is very nice. It's give us a new horizon in a change in paradigm in neurosurgery. And all this is something that we have to put in our brain and find the right solution for the patient. And tools are not just something that is gadget, but it's something that give us new opportunity to rise the level of what we can do. So to rise the level of the problem we deal with, and to every year we can reach new goals and new solution for moving up toward the target of our job. And this is something that keep us with a lively mind. We have to be every year. We have to stay up to date with what is going on in our job. We have to keep up to date with the solution, with the technical solution, with the literature, and to maintain the level, the higher level you can reach in your life. Also, being a VOR, it's by itself, it's like being somehow an actor in a theater, because you have the scenography, you have all the stuff you are working with, and it's really something that it is an intense experience, which is very gratifying and very satisfying for each one of us. And so when you are a surgeon, you will be a surgeon forever, because it's something that is very strong in our experience. And in conclusion, I choose this job because I need to have a direct feedback on what I'm doing, and being a surgeon is something that gives us an immediate feedback on the meaningful of our job. And so you will, at the end of your life, you will know that you have done something meaningful and important. Thank you for the invitation, and good night here.
Great. Well, thank you very much for the introduction. And it's always a pleasure for me, at least, to speak to medical students. And I wish you all incredible successes on your journeys to becoming specialists. And I hope that many of you will become and choose to be neurosurgeons in the future. I decided to give a talk hearing what others have already mentioned. So, it's great for me to follow Salim and Kato Sensei and Marco most recently. I'm going to talk a little bit about global surgery, because I think that is something that many of you may be interested in as you begin your careers as well. So I've been interested in Ukraine as a country in which to do global surgery for quite some time. These two individuals you may know. On the right-hand side is President Vladimir Zelensky, who's been in the news a lot. On the top is Ukrainian for Welcome to Toronto. Both President Zelensky and his wife, Elena, came to Toronto. I had a great pleasure to meet them not too long ago. This was before the pandemic and before the war. We have this mission in Ukraine to establish relations with institutions in Ukraine, to conduct workshops and lectures, practical training sessions, leading a robust fellowship program, to take equipment with us to Ukraine and to publish our experience. And over the years, we've been able to accomplish virtually all of these items. Our program now includes neurosurgery, neurology, oncology, general surgery, neonatology, psychiatry, intensive care, and respiratory medicine. This is a map of Ukraine, and the circles are where we have had missions and where we have visited Ukraine over the years. And you can see that we've been very close to the very active area of Ukraine right now, which is in the confrontation zone with the Russian invasion. But we've been to many of these centers on several occasions and other places. And it's a beautiful country. I would encourage all of you to go there if you ever get an opportunity. About a decade ago, we landed for the first time in Lviv. It's on the western side of Ukraine. It's a beautiful city and is one that's heavily influenced by Europe. These are my colleagues with whom I worked. We went to the Lviv City Children's Hospital, where we had our first mission. This is with Dr. Mark Bernstein, who's a neurosurgeon at the University of Toronto, and he came with me to Ukraine. But when we first arrived there, it was like practicing neurosurgery in the 1950s. They were so far behind in their technologies. They barely had instruments that would do modern day neurosurgery. And then over the course of time, working with Dr. Miroslava Romak, we were able to donate the equipment that you see here to various centers in Ukraine. And now in Ukraine, they're practicing neurosurgery like this. So it's been a huge advance for many of them. We have ties with the embassy in Ukraine. And this is the Canadian embassy. So this is the ambassador Lulashnik, and he's been now replaced by Mr. Wajczuk. And now we also have ties with our Canadian government. This is the second in line in the government of Canada. This is the Honorable Chrystia Freeland. And Jim Temerty is a famous Ukrainian Canadian who has donated countless millions of dollars to Ukraine, and Miroslava Romak, with whom I work. But it really helps to have these connections if you wish to do good work in countries abroad. This on the wall of this building reads as President of Ukraine. So we were knocking on the president's door at a time before the invasion and before the pandemic. But we didn't actually meet the president at that time. Here I am seen with Dr. Mark Bernstein. We helped the Ukrainians publish in their neurosurgical journals some articles along with the Journal of Neurosurgery. These are my colleagues from a city called Uzhhorod, Ukraine. And in World Neurosurgery not long ago, we published our experience on building healthcare capacity in post-Soviet Ukraine. These are two of my Ukrainian colleagues, Taras Mikotin and Andrei Kuzik, and they came to Sick Kids Hospital. This is now in Toronto, and we have this bilateral exchange program where neurosurgeons come to Toronto, and then, of course, we go back to Ukraine to help them. In Toronto, they can't scrub in and do surgery with us because of licensing issues, but we can teach them by surgical simulation. So we have lots of surgical simulation tools to help our Ukrainian colleagues learn how to do neurosurgery in a simulated setting. It's some images of when our Ukrainian colleagues have come with us to Toronto. And here we're meeting the health minister of Ukraine, former health minister, Ulana Suprun, who worked hard to make it a different healthcare system for Ukraine. And she's now been replaced, but in her time, I think she did a lot of good work. So my family actually takes origin from this region of Ukraine. My last name is Ukrainian. And here's my wife and my daughter. And we visited this small village where my family has been living for about 500 years. And so we visited them. I had never met them before. And here we are shown with members of this family. My colleagues in Ukraine helped me to set up this visit with all of them. And they were just marvelous, very, very welcoming. It was heartwarming to meet relatives I had never met before. So why Ukraine? Why now? This is our fellowship program. And this is a child who had medulloblastoma. And we operated in Lviv on this child. Her name is Anastasia, and she made an excellent recovery after her surgery, as you can see here, and has been a long-term survivor now of her medulloblastoma. They couldn't do medulloblastoma surgery in Ukraine before we got there in that institution. Here's my good colleague and friend, Pavlo Plavsky. He's at Kyiv now, and he's operating there on many complex cases, and we've been helping him with his neurosurgery. He's at the lead Pediatric Neurosurgery Institute in Kyiv right now in Ukraine. This is Isha Christian, and she worked with me at Sick Kids on her fellowship. She's now in Los Angeles at the Children's Hospital in LA, and she did this procedure with me. This is Maxime, and he had a brain tumor removed the day before this picture, and he's done extraordinarily well afterwards. And Isha comes with me frequently on my visits to Ukraine, especially now during the pandemic, and certainly with the Russian invasion. It's good to have these virtual case conferences, and these are with my colleagues in Ukraine now, and we're able to do this quite readily. So future directions for the program, we're going to expand our outreach. We hope to include other specialty groups. We will continue to have Ukrainian trainees come to sick kids. We continue to buy equipment that we will be sending to Ukraine. There's a big effort to prevent neural tube defects by introducing legislation in Ukraine to put folate in grains, because that is very important to help reduce the incidence of neural tube defects. And Ukraine has a very high incidence of neural tube defects. We're going to bolster a number of pediatric centers and, of course, return to going to Ukraine once the Russian invasion is finished. Of course, it's a very difficult time for Ukraine, and it's hard to know what the future will hold for them. This is the final picture, the Ukrainian at the top that says thank you. But this is the square, the largest square in Europe, apparently. And unfortunately, it was bombed by the Russians. So it doesn't look like anything like this now. And this is in the city of Kharkiv, which is near the border with the Eastern conflict. So I'm really hoping that this conflict will end soon, that the Ukrainians will be enabled to continue with their livelihoods, that our pediatric neurosurgeons that we're helping will be able to get back to their work as they know it. And I hope that this presentation was informative for you and helped you to understand a little bit about global surgery, in particular global neurosurgery, and a little bit about the history of and also the country of Ukraine. Thank you very much. Thank you.
May I just add a word, please, to call Professor Kato? Professor Rutka, is humble. I mean, his work is not just in Ukraine. I mean, as a global leader in neurosurgery, contributions are hard to summarize in 10 minutes. But what I want to say is that regarding Ukraine, because your Bolivia club is hosting this conference, our club in Ukraine was such a strong club before the Russian invasion of the Ukraine. So we really struggled with some of our club members in the Ukraine, the medical students, over the last couple of months. I've been working very closely with a number of our Ukrainian medical students, and we have transferred a couple of people to Poland, and we're working with a couple of very strong people who have suffered personally in their families during this war. So we're working very closely with our club members in Ukraine. We have some amazingly smart students, and we want to make sure their future is not affected by this. So thank you, Professor Rutka, for all you do for all of us, for a generation of neurosurgeons. And I just wanted to say regarding Ukraine, all of us need to come together to help here. Thank you so much.
Thank you, Salman. I'll just mention, and time didn't allow me to, that we've been accepting dozens of Ukrainian children at sick kids from Ukraine for neuro-oncology problems that they have and they face. And I know a lot of regions in the world are helping out, and really appreciate your Bolivian club for what you're doing to help with Ukraine. So thank you very much for that.
Okay, good morning, everyone. I appreciate giving this opportunity to speak my experience. So, there is some time lags between Japan and the other countries. So it's around 7 a.m. in Japan. And I was nervous in good way. So I could wake up without alarm clock this morning. And anyway, now I can start. Today I will speak about the benefits of studying medical education from abroad. From my experience with Hungarian Medical University, let me introduce myself and Hungary briefly. I'm Kotaro Kihara. I was graduated from Debrecen University. I got the Doctor of Medicine. After that, I returned to Japan for taking the national exam. Now I work as junior resident in Bantan Hospital in Aichi Prefecture from this April. Do you know where Hungary is? Hungary is a member of the European Union and also part of the Schengen Agreement, surrounded by Austria, Croatia, Serbia, Romania, Slovakia, and also Ukraine. It had mild continent climate. Population of Hungary is about 10 million. It's one of the safest countries in the world. It was ranked 19th in 2020 by the Global Peace Index. This photo is the Parliament of Hungary. In front of this, Danube River runs. The Budapest is also called as a Pearl of Danube. It is a very beautiful place. Debrecen, where I lived, is second largest city in Hungary. It has long history of more than 600 years. Debrecen has a population of about 200,000 people, and it's a college town. Every Christmas season, the market is held at the Centrum, where this year church standing, the symbol of this town. As for history of University Debrecen, it established in 1538 as a college of Protestant church. You see that it's a really old university. Now there are 28,000 students and more than 6,000 of them are international students coming from more than 100 countries from all over the world. General medicine education started in 1918. And the English language medical program started in 1987. Current number of students in general medicine is around 1,500. Here is my favorite sport at the university. During the exam periods, I often came here to refresh with coffee. From here, this is main theme for today. The biggest advantage was that I could hear and experience different culture directly from friends of all over the world. It ranged from food to habits. It was very exciting experience, and at the same time, it gave me an opportunity to think about my own country. Then I returned to Japan for contributing my own country and took the national license examination. And here I am. Here is my group mates from Nigeria, UK, Vietnam, Israel, and India. We often talked about each other's culture and future career. I hope we could meet again in Hungary someday. This photo is a graduation photo. In Japan, neurology is treated as one of the internal medicine subjects, but it's an independent major subject in Hungary. The professor of neurology was enthusiastic of education. When I started my medical study, I was interested in surgery. Thanks to him, he brought me an interest in neurosurgery. In the summer practice, I chose neurosurgery and had the opportunity to look around the operation with neuronavigation, which made me furthermore fascinated. Here is after the neurosurgery practice. And here is the internal medicine practice. I'd like to talk about certain examples of internal medicine. The exam consists of two parts, oral and practical part. The practical one is the physical examination on the patient. During the exam, I visited the patient and did through whole physical examination. When I left the room, all the patients in that room said, "Good luck with the fingers crossed." Because of them who pray for medical students from abroad like me, I want to be a doctor who can be considerate to patients' feeling regardless to nationality, age, or gender. I think no matter where you go, it's hard to study medicine. So this time I avoid to talk about the story of difficulty. You know English, which is the common language of the world. So for me, who raised in Japan, where the first language is not English, it's great advantage to have studied medicine in English. Unfortunately, due to the pandemic of COVID-19, the flow of people is still stagnated, but no distant days. I think the demand of the doctor who can communicate in English will be obviously rising in Japan. I feel that studying and working abroad is easier than before for me because I got adaptability to the environment. For example, the locals friendly taught me a lot, such as how to make traditional dish. The time I spent in Hungary gave me the confidence to live anywhere. Here is Hungarian friends. They taught me how to make Hungarian traditional dish. Everything was very tasty. This is called palacsinta in Hungary. It's one of the traditional desserts. You can put anything sweet like jam, cream, chocolate, whatever you want. I want you to try these dishes if you have a chance. Finally, I want to study abroad again. So maybe there will be a day when I can work with you somewhere in the world. I'm really looking forward to it. Köszönöm szépen. Thank you for your time and attention. Thank you so much.
Dr. Thank you very much for your nice presentation. Since you came back to Japan, so maybe you have lots of motivation to influence to your colleagues how nice the spent in abroad, especially the study in abroad. Maybe that you can extend your knowledge and also the some kind of the blood of the foreign blood to the Japanese medical student and also the resident. So please continue your motivation.
Okay,
Thank you very much. All the best. Thank you very much.
Thank you so much.
Yeah, and I want to recall a phrase that said Dr. Giuseppe Lancino on a webinar. He said, being able to pack your life into a suitcase and move to another country with the dreams that you have in your backpack and in your mind is really noble. So he did the same when he went from Italy to United States. And thank you, Doctor. You are really an inspiration for all of the students. And we really hope to get to follow the steps that you are making and maybe getting out of Bolivia, getting further education, getting to do residency abroad is really going to change many of the patients' life. So thank you, doctor.
Thank you so much.
So we may now continue with the lectures. Now we have the opportunity to be listening to Nikolai. Please, Nikolai, introduce yourself. Go ahead.
Good afternoon to all the neurosurgeons, residents, doctors, students, and participants around the world. My name is Andrea Pereira. I'm a second-year medical student. I'm from the San Simon Higher University from Bolivia. I have this evening the opportunity to present you a series from a world-class neurosurgeon from Chile. Can I continue presenting my screen?
Yes, please, go ahead.
Okay. Okay. Is it going? Yeah?
Yeah.
It's all right? Okay.
Yeah, we can see.
So I wanted to start this presentation with a question that have you ever heard that we don't need to create nothing, that we only need to complement and take advantage of what we actually have? So this presentation, it will be about the extradural mini-internal approach involving indications of the mini-internal chronotomy. This paper was worked by Dr. Jorge Mura, he's from Chile, and this paper has been supported by the Department of Cerebrovascular and Skill-Based Surgery in the Institute of Neurosurgery of Asenjo Providencia, and it was supported too by the Department of Neurological Sciences from the University of Chile, and it was published in the SNI General Neurosurgery by the editor-in-chief, Dr. Nancy E. Epstein. Now, to start with this technique, you need to put your patient on a deflected supine position with the head held by a head holder, and you need to put it in a 30 to a 45 degrees inclination, depending on the neurosurgeon comfortable. And the technique, it will start by using the dissection of the skin and the subcutaneous tissue. You need to put it, and the difference between the another techniques, like the Ternal approach that has been described by Dr. Yasser Hill in 1975, and this technique is one of the most used techniques in all the world in neurosurgery. But the difference between it's the localization and the deepness that you can have, making the mini-ternal extradural approach that is better than the ternal approach. And with these measures and clarifying this, you can have a question that what if I told you that the size doesn't matter? What really matters is the deepness, the localization of what you're doing. And in this technique, we are going to emphasize and make a really focus on this. The focus will be on this technique. After you made that incision that I have told to you, the incision will be make a 2 centimeters up the zygomatic arc, and in the hemipupil line, you need to follow the anterior infant hairline, and you can now expose the temporal muscle, and the temporal muscle will be held by 3 points The 3 points will be placed on the anterior board, the base, and the anterior part. You can put these parts and you can hold this part to go to the next part. And in the next part, we will be doing right here the small bone growths to start the craniotomy. And in the craniotomy, you will have the advantage that you can have more view, you can go more deeper to proceed. And in this part, the most important part is that you can have school-based surgeries and you can treat that school-based lesions. So you can have this technique as combining some other techniques from school-based surgery, like the extradural appendectomy and middle fossa peeling, the Kawas protostomy, the transcavernous approach, and you can operate school-based lesions, as I told you, and you can obtain, combining this, the extradural mini-terminal approach. So in this paper, the results have demonstrated that the cases were performed with the mini-terminal approach and the mini-terminal extradural approach, and no mortality or additional morbidity has been reported in this part. And the outcome of the patients present really good neurological results, and only 2 patients have a paralysis from some cranial nerve, and only 1 patient has mild hemiparesis. If you want to know more details about this, the data, it will be placed on the original paper. That is, you can search it like with the title of this presentation, the extradural mini-terminal approach involving indications of the mini-terminal craniotomy from Dr. Jorge Mura. Because of the time, the data is too long to present it now. And to discuss, and in the part of discussion of this presentation, we have that since 2016, Dr. Mura and his team have been working on it and have been combining these techniques of the school-based surgery and other techniques to have the result of this mini-terminal extradural approach. You can have, in addition, that this technique can change the paradigm of having a large operating dissections don't mean that you have a better or you can improve your results at the end. So then you can have that this mini-terminal approach represents a valuable and enough option, since it provides access to many parts and you have a better view of what you're doing. And it was found that the other techniques may not be performed using other minimally invasive techniques. So this one is this technique can allow you to have a better recovery of the patient. You can have a better way and a faster way to recover the patient, because with the traditional terminal approach, you need a bigger incision. You have some things that make the recovery going delay. But with this technique that I have told you, it's a better recovery and you can improve every part of the surgery. In conclusion, with this, the size doesn't matter. You don't need to make big or larger incisions or big or larger craniotomies. You only need to position it on a better place. You can have a better way and a better view of what you're going to do. And this is it. I can say to all of you that thank you to Dr. Ira and to Dr. Cato for this opportunity, and to all my family of Dandy Club in Bolivia. And thanks to Dr. Salim for always being supporting us. Thank you.
Nikolai, you're doing a great job. Very nice presentation. We're proud of you.
Thank you, Doctor.
Thank you so much, Nicole. I'm going to share my screen now. Okay. Everything's going great. Okay. Well, I hope that everyone is having a good day. I am Angelica Fontova, third-year medical student. I have the pleasure of presenting such an interesting topic to such a distinguished public. This review that I'm going to present is virtual reality in neurosurgery become neurosurgical planning. When we think about virtual reality and augmented reality used in neurosurgery, the first thing that is coming to our minds would be the use of this technology in surgery planning. This is the most intuitive way to think about the use of this technology, but the truth is that can give these recurse more uses in the neurosurgical area. With respect to the materials and methods, this is not intended to be a systematic review of the literature. The search was carried on PubMed, PubCentral, citations on the Web of Science core collection database. This review is based on 95 reference, and the search was started on November 1st of 2020 and finished on August 25 of 2021. To start to talk about the topic, we need to define what is virtual reality, what is the difference between virtual reality and augmented reality, and what happens if we mix these technologies. Virtual reality refers to computer-generated three-dimensional immersive environments, depending on whether the virtual world is designed as a virtual environment, a convincing substitute for the real world. Virtual reality is further classified as not immersive and immersive, respectively. Augmented reality refers to the projection of computer-generated images onto the real-world images. And mixed reality refers to the projections of virtual objects into the real world, where the objects are especially aware and sensitive. Starting to talk to the first use of virtual reality in is the neuronavigation in the neurosurgical intervention. For example, the report published by a neurosurgeon for Roman Brigham Hospital illustrated the potential advantages of using virtual reality as a neuronavigation tool to report consistency of using virtual reality by a construction of 3D model on patient's head and fusing this with the real-time magnetic resonance imaging on an open magnetic resonance imaging. This facilitated the intraoperative navigation in minimal invasive surgeries by a 3D construction on images, preoperative and intraoperative fusion of these images with a real-time magnetic resonance imaging, where essential landmarks and critical neurovascular structures were superimposed on patient's head on the screen that can be equivalent to have X-ray visions. And this can have to, for example, remove tumors more effectively. One of the biggest use that virtual reality can have in the neurosurgical area is the training of the new generation of neurosurgeons. It's important that they have a good base of neuroanatomy to have security and successful surgeries. The controversy of this use of virtual reality for neurosurgery training is that during surgery, the anatomy of the brain changed, and the use technology is only based on preoperative images, and this is a not realistic use. The system to fix this problem is an intraoperative brain imaging system, like we can watch in this imaging, was devised that identifies any discrepancies between intraoperative ultrasounds and preoperative imaging uses this technology. The intraoperative simulation is modified in real time, and in a course are updated uses augmented reality. This is useful to reduce the cognitive load and operative stress during the process to enhance efficacy for novice neurosurgeons. I'm going to start mention the use that can be given to virtual reality in the preoperative and postoperative process. A very important preoperative process is a consent talking, especially in the area of neurosurgery, as it is one of the specialists with the highest number of liver claims. Investigations showed that giving informed consent to the patients with the use of the virtual reality, using this technology, allow patients to understand more about the procedures to perform it, reducing the preoperative stress levels. A postoperative use, such as rehabilitation, we find a significant advances in virtual reality. For example, making it more comfortable for a virtual reality recognition that patients with difficulties to move can do this to the comfort of their homes. The advantages conferred by virtual reality stem from the ability to gradually increase the complexity of tasking, facilitate the simultaneous audio, visual, motor, and cognitive rehabilitations, remains engaged and intending, and offer cognitive reward-based feedback, which is a paramount importance to prevent patient frustrations of drug use. We are going to mention some of the last use that we can give to virtual reality within the field of the neurosurgery, such as a training of operative room technicals. Virtual reality has also shown promise in mapping social cognition during awake craniotomy and other complex cognitive functions that are routinely not mapped during the surgery. Finally, virtual reality has also been used to improve patients' compliance and comfort. Studies have shown the utility of virtual reality is preparing patients for magnetic resonance imaging examinations at virtual reality headsets and are commonly used to prevent the intense discomfort faced by patients while undergone to the magnetic resonance imaging. Well, to finish this little exposition, and after all the advantages of using virtual reality in our surgery has been exposed, we are going to mention the problems that this technology faces. The main issues that have halted the monumental rise of virtual reality in our surgery include that are not limited to feasibility in application and transferring to the real scenarios, ethics, and supplementing with a started practice and the cost effectiveness analysis. In conclusion, we can say that virtual reality is a very important tool in the area of neurosurgery that must be taken into account not only for playing, but also to magnify the potentials and reduce the limitations. And this invites us to continue researching and exploring this amazing area. Thank you so much. Thank you so much for everyone for the support.
Good afternoon, everyone. My name is Nicole Fuentes. I'm a fifth-year medical student from Bolivia. When I first got the invitation and the opportunity to organize this wonderful event, I wanted to find a way in which I can show how much gratitude and how much passion I have towards this specialty. So I decided to name this lecture State of the Art on Latin American Neurosurgeons. So I can say that how can I make justice to all the work that they do? So all the incredible mentors I got to meet in this time, all the incredible professors really made me feel highly motivated to follow this path. So I wanted to honor all of the neurosurgeons in my part of the world. I have known many neurosurgeons in these webinars and in-person meetings, and I really want to show you what I have learned, and maybe some of this will help you in your way. So with the permission of Professor Cato, Dr. Salim, I will continue. I consider that the next, please, the first question that comes to our mind when we decide to follow this path of neurosurgery is, how do I get there? So this is a very important question. And the next question that we have is, where do I start? Next, how, and the most terrifying and the most, I think it's the most worrying for all of us, is, am I capable of it? So neurosurgery is a very amazing field, but the capacity that it requires, the mind that we think that the neurosurgeons have, we think of them like gods because we really look up to them. And this is a very worry question that I had when I first started. When I was a first year medical student, I had no one. I didn't know many of these amazing platforms. I didn't know many neurosurgeons in my country, in my department in Cochabamba. So I went on a journey to maybe discover some of it, and here's what I have learned from now. So next, I am going to present my doctor. He's Dr. Eddie Raul Sarmiento. I consider he's my mentor. He works in many hospitals here in Cochabamba. He did his residency in Juarez Hospital in Mexico. When he came back to Cochabamba, he really set up a difference between the neurosurgery that was happening after he came here. He's such a noble professional. He have so many patients. With his patients, he also likes and loves to teach students. As you can see in that image, he's teaching intern, and he really likes to pass the knowledge to the future generations, and that is really something I I like of him. He makes you feel like you can do whatever you think even before you think it. So a mentor is one who knows your capability, maybe even before you do, and helps you get it out on you and discover it in their way. So he also had a great mentor. The next one we can see Dr. Trigo. Dr. Trigo was a huge neurosurgeon here in Cochabamba. He passed away last year. It was very sad. He had like very concept of neurosurgery that the neurosurgeon, the next one, it was his phrase. It says that you have to do the best or you don't do anything. So it always pushed us through excellence. So in the images we can see he was at the wedding of Dr. Sandra Campero. She's a colleague here from Cochabamba. He likes to teach. He's there with an intern. He did his specialty in France. And the next one, we can see that a part of being a neurosurgeon, he was also a great artist. So please, Angie, if you can hit play, we can hear like a concept of he was sharing in one meeting of the neurosurgery chapter, and he was like a great singer. And the next one I want to show you is Dr. Luis Miguel Duchenne. Dr. Duchenne is from La Paz. He's a spine surgeon. He really likes to make his way through these webinars. He had the opportunity to participate in many webinars. One that was hosted by Dr. Sameh, that we know is the president of the Egyptian Association of Neurosurgery. He likes to host many events. He's a very active member of the Latin America Federation of Neurosurgery. He's the president of the spine chapter of the flank, and he is also very motivated in teaching students of the next generation. He's very loyal to his patients. He is really kind to them, and they really notice because there are no many professionals that can do that, and that can be like good neurosurgeons, and that can be also good persons. So that is something I really admire of him. Next, we have next doctor, please. We have I love Dr. Byron Salazar and Dr. Jorge Salazar. They are father and son. They are from Ecuador. They have like a very active role in the Ecuadorian Society of Neurosurgery. Dr. Byron Salazar is the president, and they got to host many important neurosurgeons around the globe in his weekly webinars, and we get the opportunity to participate in them. They both do a great job, and in the next slide we can see maybe something that we can dream of, that his own father of Dr. Byron Salazar is sharing an operating room with his son. So the next one we can see that, and it really inspires us. They both work in the Metropolitan Hospital, and they get to share experiences, they get to share patients, and they get to share knowledge. And Dr. Byron Salazar once told us in a webinar that he really found his inspiration in his father, because as he was growing up, his father was very patient for his patients. He really liked to treat them well, give give them the best opportunity and the best knowledge that he had been taught. So the next one we can see, the next doctors that I want to present you, they are from Brazil. A huge one, we have Dr. Luis Borba, we have Dr. Perez Chadat. Dr. Luis Borba has been appointed the head of the Educational Committee of the World Federation of Neurosurgical Societies, and he's making such a great job. Since last year, he had been organizing many events for students and for residents. He's a very active member. He always likes to participate. We can see in that image that he was invited to operate in Kuwait, because he often travels to do surgeries with many of his colleagues around the globe. He's from Brazil, but he speaks, I don't know, like 5 languages, and that is very great because he gets to have many friends, he gets to help many people, and he helps to develop many neurosurgeons. His interesting book, Microsurgical and Endoscopic Approaches, was released this year. And here we can see he has been appointed professor by the Sufyanov University by Dr. Albert Sufyanov. We can see in that image. And also I'd like to appoint Dr. Perez Chadat. He's like a huge profile in endovascular and vascular neurosurgery. I really look up to him. He works in Sao Paulo, Brazil, and he had been also in many webinars along with the Asian Congress of Neurological Surgeons. He has a workshop, a laboratory for microanatomy in the Paulista Medicina of school. So he gets to teach medicine students, and he gets to teach fellow residents from all the globe. So they both are doing such a great job, and they are known in many parts of the world. They are like relentless workers. They always like to give their best. They always like to help the most for the patients and to teach the future generations. The next one we can see, I admire them too. They are from Argentina, Dr. Graciela Zucaro and Dr. Javier Ramos Gonzalez. They both work in Garraham Hospital. They both are pediatric neurosurgeons, and they have such a noble labor. Dr. Graciela Zucaro is being like one of the most important women in developing neurosurgery here in Latin America. She has been the president of the International Pediatric World Federation. So she has also worked in many papers. As we can see, she has many publications such as lateral ventricle tumors and radical resection of craniopharyngiomas, such as also Dr. Javier Gonzalez. They have been working together very closely for many years, and they have developed many techniques, and they are really the face of pediatric neurosurgery. And the next one we can see, Dr. Graciela Zucaro was receiving the presidents of the International Pediatric Association, and Dr. Javier Gonzalez was presenting in the Guanajuato Congress for Pediatric Neurosurgery. And in the middle image, we can see Dr. Aníbal Fuentes. He's from Mexico, and he was the dancing tango with Dr. Graciela. And it was such a lovely time. And I think the Congress and in-person meetings are really a opportunity for us to meet all of our mentors, to meet all of the ones that already have been through the path we want to follow step by step, and that we really feel very motivated by them. So the next one, we can see also two huge neurosurgeons from Argentina. It's Dr. Matthias Valdossini and Dr. Alvaro Campero. Dr. Matthias Valdossini is also a huge face for vascular neurosurgery, and they both had created this amazing project that is called the Neurosurgical Guide. It's a page on Instagram that they have to upload the videos on their techniques, and there you can see they have already uploaded like 6 videos of 6 different techniques, and it's very educational. So they are really like trying to make the neurosurgeon education to make it available for everyone in the social media. So if you can go check it, they have an amazing job. Dr. Matthias Valdossini as well as Dr. Campero, they like to participate in many webinars. They like to also help many students that they can. And we are really grateful for them because they really have the time to have their lives and to also have their neurosurgery life and to also have their teacher life. So that is the kind of combination that we can see many often, but we really appreciate it and look up to it. So in next one, we can see Dr. Matthias Valdossini's work. He will be in a conference in June 10th, and together with Dr. Michael Lawton, and they have published many works. Next, we can see Dr. Jorge Mura, who Nikolai was talking about. He's a great reference for his technique militarianal approach in an extradural approach. So the thing that he has is like he can access a way from a very different approach in a very different direction, and he can get more exposure. So I think that his innovation is really changing the face of neurosurgery, because we have to work on the work that has already been done, and that is what they have done. And Dr. Ibe Chirian the last year was making like a series of conferences with Dr. Mura, where he got to develop each one of his techniques by questions, step by step, and it was really wonderful to be part of it. Dr. Jorge Mura is also the president of the Chilean and Society of Neurosurgery. Next, we can see um, his phrase. His common phrase is like, one isn't born a master, one becomes a master by his students. So he's really a master and is considered a professor and master of the education in Chile. So next we can see the work of Dr. Victor Hugo Perez. We really like him very much. He's a really interested neuroanatomist. We call him like the Rodon of Latin America because his job is really incredible. I had opportunity to meet him in person and also to meet him in webinars. It has been really interesting, and also he has these anatomical models of the spine. He calls it the crazy spines because in the next one we can see that it shines in the dark. So it's really like very wonderful job he has. It's his job together with his wife, and he really likes to teach students. And we actually have a series of webinar that is called Back to Basics, and he's really teaching us step by step like the vasculature, like all the arteries, and taking the time to pass his knowledge, showing us his beautiful illustrations. And next, we have the image that I wanted to show you. This is how I feel, and maybe like everyone feels once they get into med school and once they decide what specialty they want to do. So we are like basically children, and we have to follow the path of our mentors that already have been through. They already have been through the problems. They already have tips that we can learn from them, and we really can follow their lead. So next we have like a series of webinars and a series of phrase that I like very much and that also Dr. Jorge Mura is always saying. if I have seen further, it is by standing in the shoulders of giants. So this is the work that we are doing, as neurosurgery is a very changing field. I really like every perspective of it. I think that neurosurgery can go farther and farther, and it is by the combined work that we get to do with all the colleagues around the world. And these webinars really help us to build these relationships. So I think this is the next step that we want to make. And in the next one, like we began, it's the Guanajuato Congress for Pediatric Neurosurgery that I got the opportunity to attend. Here we have many renowned neurosurgeons. It was an honor to be part of them. And here we have Dr. Graciela Zúcaro, there is Dr. Dacuna from Brazil, Dr. Kemel from Colombia, Dr. Cáceres, Dr. Javier, and Dr. Fernando Chico was his homage, and Dr. Erika Cano, who kindly invited me to attend to this meeting, and also many neurosurgeons that Dr. Chico has formed along these 46 years. Next, we have the webinars that we have been working on. Next, please. So this was the first meeting that I had with Dr. Selim, the first opportunity and where it all came from. And here we can see how much we have gone through. The next one, please. So we have also been working with Dr. John Bennett, Dr. Victor Hugo, and with many colleagues around the globe, Uriel and Mauricio and Fernando. So next we have like what we think that we can accomplish with Dandy Club Bolivia. We have a very important group of students that are leading forward neurosurgery, and we really hope that our path can help them in some way. Next. We had our first meeting with Dr. Leon the past week, and he really supports us. He's part of our team, and we really appreciate him. Next up, we have the what everyone thinks that it's neurosurgery. Well, it's not that. Maybe Dr. Shepard and Dr. Korasic, it's not that. The next one, we can see what it's really about, that we all want to follow a path where we can get to become one of them. So also they are our role models, all of them from Latin America, from around the globe. We really feel inspired. I feel inspired and motivated, and I can't wait for taking this journey. Go ahead, please. And we also want to become like this generation of neurosurgeons, and also like pass the knowledge that we have to the next generation. That is all for me. Thank you for your attention. It was a really important webinar for me. I wanted to show you the work that the Latin America neurosurgeons have been developed, and I want to thank Dr. Cato, Dr. Hira, and Dr. Salim for this huge opportunity for us, and I really hope that you all have enjoyed it. Thank you very much. We would like to host an annual meeting in Cochabamba. You will all be getting notices about it. Maybe the date will change, but we really hope that you can get on board with us. Thank you.
Thank you, Nicole. That was wonderful.
Thank you, Dr. Hira.
Thank you. Nicole, do we have any more speakers from your session next?
No, that was it. And next we can go ahead with you.
All right. Thank you so much. So thank you, everyone. Nicole, for moderating the first session. Thank you, Professor Cato, for your kind support, as always. I see a lot of students and residents who have participated. Thank you all for coming here. We start with the next session about AMSRS. It is the medical students wing for ACNS, and we are doing a job to bring together the students, residents, and consultant neurosurgeons together to build the society. Nicole is doing an excellent job. The Dandy Club, I thank you all, Professor Salim Abdul Rauf. Before starting ahead with the session, I would just like to pay a small tribute, just like Nicole did, to the role of mentors who have been so important in making us who we are, in helping us decide who we are, and most importantly, to overcome the challenges that we face in our careers. When it comes to challenges, it doesn't really obviously mean challenges in academics, but there can be other challenges such as economical challenges, domestic challenges, challenges with health, and so many things people are fighting every day just to become a better person each day. I would like to share my screen and just a small presentation because we're already running ahead of time. So if you could just, it's just a very small slide, and I would like to talk about how the AMSRS came into being and what do we mean by mentors. So when we graduate from medical school, we are in a dilemma, what to do, what to pursue next. So what we need at that time is some inspiration, someone to direct us, some guidance, something which can help us bring the spark out of us. So that is the role of mentors. And in my personal experience till now, I've seen so many people who have been my mentors in this journey of neurosurgery. First and foremost, they help us guide through the right path and help us select the field which we want to pursue. This is Professor Salman Sharif. I met him when I was a medical student, and he is an excellent teacher in Karachi, Pakistan. He is doing a wonderful job in organizing these conferences where he involves medical students, and this is where I took flight from. So Dr. Salman Sharif is currently a spine surgeon in Karachi, and he's a very famous mentor for medical students, and he has made us excel in our fields. AMSRS was officially started in March 2018 when we had a meeting in Dubai at the 12th ACNS conference. At that time, we just discussed a role of organizing a students' wing for ACNS, and it was like a dream come true when we got some recognition. And I thank Professor Kato, Dr. Aipcherian, Professor Tariq Salahuddin. They all supported us in this venture, and it was from this day onwards that we took an official name of the AMSRS. The next move was to establish some kind of support for young neurosurgeons and residents who would like to participate in international conferences. This is back in 2018, where we combined with the CFN review course organized by Professor Nabil in Saudi, and we had the opportunity to take some of our residents and young neurosurgeons on a scholarship to this amazing conference, which he organizes almost every year. It was a wonderful experience. This was our first official workshop and conference in Nepal with at the Nobel Institute of Neurosciences with Dr. Aipcherian. And it was a great event where most of the participants were young medical students, actually, not even neurosurgeons. As you can see, we were graced by the presence of Professor Kato, and she has always been there to support us. And it was a hands-on workshop conducted for medical students. So this was another success of AMSRS. Next, again, Professor Kato, who has always been my mentor and mentoring so many medical students and young neurosurgeons, especially women in neurosurgery. This is back in Toronto in 2018 at the Sick Kids Hospital. We had this Asmrs conference where she supported the presence of AMSRS. This is in Italy, Naples. We had the opportunity to represent medical students in the ICRAN conference. And as you can see, we have a resident, Andrea is here, and he's now a surgeon. He graduated. And again, Professor Cherian, we have Professor Wang, Professor Roy, and Professor Goi from China. So they have all been great mentors and supporters. And this was back in January 2019 where I visited Fujita University, and it was a great time with Professor Kato, and seeing her institute and being a part of the winter CVD workshop. I got a chance to know more about the community in Japan and how things are advancing there, and what do we need to do to bring to meet the ends between medical students and neurosurgeons. So I am personally thankful to all my mentors and more who I was not able to mention in this presentation, and to those who are still facing challenges. I really recommend them to seek mentorship, and that is what we are for. We can help you link up with neurosurgeons. You can talk to them. You can just know where to start from. So this is what AMSRS is for. Most importantly, the support which we as women need is through our families, our spouses, and I'm lucky enough to have a husband, and we have 2 kids, and I mean, I just wanted to share that he's doing a great job as well. Like Professor Kato said, that we need to have support from our families. So I strongly support this fact. Without them, we cannot do much. So Professor Kato, thank you once again. And I stopped my screen. I just want to continue with the session. So Professor Kato, I would like to really thank you for this opportunity, Nicole, for helping support and organize this event. And without further delay, may I request Dr. Sharon. Nicole, do we have slides for her introduction? Do we have slides for Dr. Sharon? Dr. Sharon is presenting. Yeah. Yes, please. I would like to introduce Dr. Sharon from Malaysia. She is a mentor to many medical students in Malaysia, and we are really happy to have her here. Nicole, can you please have her slide? Dr. Sharon first. Dr. Sharon. Okay. I'll introduce Dr. Sharon then. Yeah, so we'll have Dr. Sharon with us from Malaysia. Dr. Sharon, please, you can start your talk. You're muted, Dr. Sharon. You're muted.
All right. Okay. Hi. Thank you so much, Hira and Prof. Kato, for this opportunity to try to present something to give my own experience in how medical students and residents throughout my career, and how I've managed to actually interact with them. So what I'd like to bring out today is, can neurosurgeons influence our medical students and residents? So as we see, a focus has been on medical students, I think, in the recent years, because we realize they are the future of our fraternity, and we need to mold them from the very beginning. So we've been concentrating with them quite a bit. So my experience with medical students started off in 2009, when initially under Monash Medical University, they used to send fifth-year students, final year students, to basically shadow me for about 6 weeks. So here I had a lot of interaction. You can see there are some pictures of them which they took at the end of the 6 weeks posting. I've had students from Africa who came down to do electives with me. I've had, of course, a lot of Malaysian students. So when they came out and did a rotation with me, I started to realize that actually a lot of medical students are not very exposed to neurosurgery during their medical training. And because of that, they have not much idea. What they see is like what Nicole showed us, sometimes, what you get an impression from the movies and TVs and things like that. So as I went on, the thing is, what happened is in the place I work, we do not have a neurologist, or sometimes we do have and sometimes they're not there. So what happened over the years, starting from 2016, they started to ask me to take on third-year medical students. So what happens is, third-year medical students come to neurosurgery for a week. They do a rotation for a week, following us, doing rounds, going to the operation theater, getting exposed. And over years, what I do is I do bedsides with them. And basically, I actually treat neurology with neurosurgery integrated. So I make them basically get interested in the brain and the spine and the nerves, and also how it correlates with surgery. And here you can see the third-year medical students who are actually very excited when they come to neurosurgery because they know it's a subspecialty. They think it's a great opportunity. And over years, I've started to realize that because of this exposure, they start getting very curious. And then I start realizing that actually a lot of them get very interested in this field. It's just that they're not exposed, they're not given the opportunity, but when given, they become very, very excited. And that is how it looks like, we need to do more for the medical students so that they can understand what is neurosurgery about. And of course, over the recent years, because of the pandemic, we've gone to webinars and, having a lot of webinars, just like how Nicole has organized for the Bolivian students. The Malaysian students do this. And of course, in their presentation, I do tend to go overboard sometimes, even though it's 2 hours presentation. You show them different videos so that they get more interested. And of course, at the end of it, I suddenly realized they have a lot of questions. So Malaysia has their own Medics International. And I'm, of course, invited to speak as a woman of my own perception of being a surgeon and a neurosurgeon, and also sometimes presenting on certain procedures we do in neurosurgery. I've been given of course, the task of giving this talk every year in Monash Medical University, which is a kind of a privilege and an honor because I'm a neurosurgeon and I'm a woman. And the talk is actually basically on the surgical pathways and options you have. And here you can see with a few of my final year medical students. It's interesting because, I know them all quite personally and I know where their career pathways have gone. And it will be surprising to you that some of them, like this young man here, he actually graduated as a medical doctor and he now just got his master's for biomedical engineering. This young lady here, because of own personal reasons, actually, she's now actually a social influencer. So, and this lady here, she's actually doing obstetric and gynecology in Brisbane. So basically, their pathways have taken them in different paths. But it's interesting because when they do neurosurgery, they come to learn a lot of other things, and they come to learn how fascinating the brain is, which I try to make everyone aware of. And of course, when you come to teaching, there's always the residents. And residents, I know it's a different path. And like how Nicole put it, I think we take medical students are the children, and then our residents are our teenagers. So the children, they are easier to mold, they are easier to, influence, and they are easier, they are interested, they've got a lot of questions. And then there's our residents who are the teenagers. And, they're different. Some of them, they've got their own mind, they've got their mindset, and sometimes you need a bit of pushing. All right. And of course, there's this generation thing. All right. But of course, in that group of residents, they're always the ones who shine out. And here you can see some of my specialists who I'm very proud of that I trained. Okay, so we have quite a big group of doctors in my hospital, and there are a large group of women. And to tell you that just like how Hira presented, all these women here, okay, this specialist, she's not married yet, but the rest of them all have children. She has 3 kids. She's got 4 kids. She's actually got 1 special kid, and she amazingly is a fantastic neurosurgeon who can spend her time equally at work and at home. So, it's about work-life balance and how you, adjust your time. And of course, let's not forget when teaching is also our allied health. We need to influence them too, because they are part of a team. Neurosurgery, it's a teamwork. Okay, it starts off with the doctors, the surgeons, and also your allied health. So you need to keep everybody in the loop, right? So how significant is medical students and residents in the future of neurosurgery? They are basically the backbone of fraternity and are indeed our future. You are the ones who are actually going to make changes that matter and maintaining the ideas that positively impact neurosurgery. And of course, you need empowerment in order to play your roles in the development of the society. So who can influence your medical students and residents and what career pathways they take? Of course, the neurosurgeons. You play a big role in influencing the medical students. Then there's the community, like Hira said, it comes to family. All right, if you're having a partner, because I won't say America, some of us have partners, your children, how this influences you. And of course, your peers. Now you have a lot of pressure. The present generation, you have a lot of pressures from your peers itself. Everyone's competing. Everyone wants to be better than the other, in every other way. So these are a lot of pressures you get from every point of view. So what are the factors that can actually influence you? So one is your personality. I think Professor Nzato did mention that earlier. All right, personality is important. So when you're planning to choose neurosurgery, think of how your personality is and how this can actually shine in your passion and when you take up neurosurgery. Okay. Then is your interest. We have a lot of interest, all of us, and it's not really our personality, but interest helps. So being interested gives you this thing where you become passionate about. All right. And then there's your values. Like I think Prof. Kato talked about, when you're doing neurosurgery, it's very important. Life matters. All right. And I think a few of our senior professors mentioned earlier about mortality, about morbidity. So these are all your core values. You have to make decisions based a lot on your core values. And sometimes there's conflicts. So these are the things that you need to think about whether I'm going to take something like that. Because of course, neurosurgery, a lot of things come with your interaction with your patients, with the family. And you have to have a lot of integrity and honesty to be able to achieve this. Skills, abilities, and talents. And these are important. So of course, when you want to become a neurosurgeon, we always talk about dexterity. That is something that's important. And of course, you have to have talents. You have to have good communication skills. You have to be creative. All right. You have to want to learn. You have to work with a team. Right. These are all important things. And of course, the other influencing factors of culture. All right. So when it comes to women, it depends on your culture and your background. But believe me, these are little things that you can always break free from. A culture can corner us to be in certain situations. So what I've actually seen throughout my years teaching medical students and residents are, now women are very good workers. They work hard. They're very dedicated. But somehow or other, over time, I always realize some of us become, we're not willing to go, not that we're not willing, we are afraid. We are afraid to take the next step. And believe me, this is not something you should be afraid of, because I really believe women have a lot of resilience. And this, I'm telling you from medical students. If you see pictures of my medical students, you will see that they are 80% to 70% women and 30% male. And in fact, nowadays when they come and do bedsides with me, I'll say, oh, it's no more rose among the thorns, it's a thorn among the roses. And but you all need to have more confidence in yourself. Believe that you can take the extra step. Don't worry. Remember, you need to just know how to manage time. And when you do that, you can achieve everything you want. You're just as good as any other male neurosurgeon out there. All right. So socioeconomic factors, these are other things that you can come into play. Just let me tell you, if you think you're going to become rich immediately by being a neurosurgeon, that doesn't happen. It takes years. And of course, but believe me, the commitment and the time and energy put into it, it actually makes a difference. All right. And then, of course, perception of careers. Like I saw the first picture, I don't know whether you noticed, neurosurgeon, I put a picture of Dr. Strange. So this is how social media influences, in choosing our careers. It's not about the fact that it's glamorous or desirable, because some of you think of it that way. And then when you get into it, oh, it's not that. So, but the reality is a lot of students usually ask me, how do you find balance in your life? So I always tell them, if you love something very much, believe me, just like if you love your partner very much, you do go all out of your way to make them happy. It's the same in neurosurgery. If you love it, you will go all out of your way to make sure you succeed in it. And the other thing is, when you talk about becoming a neurosurgeon, believe me, don't limit yourself to thinking, oh, I have to do this and I have to be a good surgeon, or become depressed or disheartened when you think, oh, I'm not that great. Because there's so many opportunities in neurosurgery. There's research, there's technology, there's, neurosurgery is a very innovative field, it's everything about technology. You can go in there and learn how to innovate. And there's always the administrative part of it, doing things like this, reaching out to people, informing about neurosurgery. And of course, in the end of the day, it's becoming a surgeon. So what are the visions for the future? All right. So for me, I believe that, it's like Whitney Houston's song. I don't know whether you all know it. Children are our future. So like this, I believe medical students are our future. We need to start with them first, give them enough influence and encouragement. And of course, training. You can start at local level. You can, do workshops, interaction with them. And of course, we can invite experts. Like here, I invited Prof. Binsu. He's from China. He came down to Malaysia to do a neurovascular workshop. And we invited a lot of people from Asia, Southeast Asia, who came down for a 3-day. It was a combined neurovascular with cerebral revascularization. And the main thing I want to just tell you all guys out there, medical students, just remember, I know your generation really wants this work-life balance. You want to work hard, but yet you want to really enjoy. And believe me, you can. You can have both. If you just learn from the very beginning how you can balance your time. Thank you very much. This is where I come from. I think that's the introduction. I'm from Johor Bahru. It's a city south of Malaysia. It actually just borders, and you can see here that is Singapore. And there's just a little bridge that crosses over less than 5 minutes, and you're in Singapore. So we have a lot of interaction between my state, and Singapore, and we do a lot of exchange of views and students, and we go on to exchange a lot of knowledge. Hope one day everyone can come over for a holiday or a conference in my country. Thank you.
Thank you so much, Dr. Sharon. That was a great talk. It's great to see so many students who are under your mentorship, and definitely we would like to visit your place sometime. Professor Kato, would you like to comment?
Yes, the Sharon is one of the role model of the female doctors, and also that he has the great skill and also the knowledge, and also the great mentor for many of the medical, especially the female student and the residents. So I wish you very great success in the future. Thank you very much for a great talk. Congratulations.
Thank you.
Thank you. We are joined by Professor Aib Cherian. Professor Aib is, Dr. Aib, are you here?
Yeah, I am.
All right. So it's very early for him in the morning, and he has joined us now. So, Andrea, we would like to have Professor Aib Cherian first, and then we can continue with the talks. Cherian is the Director of Neurosciences at Krishna Institute of Medical Sciences in Karad, in Maharashtra. He is one of the leading mentors for medical students and residents, and a leader in the ACNS as well. Professor Aib Cherian will be talking about innovations in neurosurgery. Dr. Cherian, please, would you like to start?
Thank you very much, Hira. It's a great opportunity for me to be talking to the future of neurosurgery. Well, when we talk about innovations, this is something that I always dream of, along with a few other things as well. But then, and background music also for me.
We need to mute other participants, please. I see.
I don't mind the snazzy background music though.
Sorry. Good morning. How are you? Still the midnight Hello. For you. Thank you very much for your contribution. So please mute. So during the great teacher will talk soon. Okay. Please continue.
Yeah. So As usual, I started. I thought we will talk about cystinostomy as well as the cooling and cleaning mechanism that we described, but then that would be boring. So we thought we would go into something that we recently did and how we did it. And this is what we came up with. So 3 days before we did this case, and you should know a little bit of a background here. This was a tumor. This was an intrinsic brainstem glioma. So when you say an intrinsic brainstem glioma, you must understand that it is surrounded by the brainstem on all 3 sides. All 3 sides. And the only way you can get in here is the front, from the clivus. There's no other way. And when you enter from the front in a brainstem glioma, the problem is the vessels are in front. And not only just one vessel, you have 2 vessels called the vertebrals, then a vessel called the basilar, and there are vessels from the basilar which are running, parallel. So you got these very small windows, and to make matters worse, then you got these 2 6th nerves running from the pontomedullary junction all the way up. So you got about 16 sectors. So you got to go through this clivus, and you got to enter the brainstem, and you got to take out this. This is what was the tumor like. So it was termed inoperable by most of the people who saw her, and she had reached a critical volume, and she was going quadripartic. So we had to find out ways to do something for her. Well, innovation is one thing. So we work, as Hida knows, we worked with, we figured out how the brain is cool and clean. We figured out CSF shift edema. We are working on exoscopes, new exoscopes. We believe that the instrumentation in neurosurgery is primitive, and so we need to do something. And we're working with companies for that. But this is a different kind of innovation. Here, you have to unbelieve that this tumor is inoperable. And you're going in with a 35-year-old young woman's life at stake, and you need to innovate there. And we looked at papers which showed this. There were 3 papers which showed a brainstem glioma being taken by the transclival route, but there were small tumors. This you can see. So you will see the entire tumor here. So that's a tumor. And so it starts from the brainstem. It starts from the midbrain, goes all the way down to the medulla. You must know that diffuse pontine tumors are inoperable. But this is a tumor that is not diffuse. It's not dorsally exophytic, as the common term says. It's ventrally exophytic. And it's not stopping. It's stopping as the decussations, which means the pons has midbrain above and medulla below. So at the upper part of pons and lower part of pons, there are fiber decussations. And if the tumor stops there, that means it's not malignant. So, and this lady has a history of over 1 year of deterioration. So we, and that radiological pattern was something that it was not, it was not looking malignant. So we thought we'll go ahead. And so this was how the tumor is looking. And you can see diffuse enhancements within the tumor. We were hoping it, against all hope, that it could be an epidermoid, but then we understood, no, it could not be. So we had to come in through the nose. We had to come in through the sphenoid. We had to come under the pituitary, And we had to go up to the midbrain to the vertebrobasilar junction. This is the vertebrobasilar junction. This is the medulla. You can see the words there. Actually, the vertebrals are there. Right when I open the dura, it's going to be right on top of me. But what happened is there were a lot of neurosurgeons here to see the tumor, but then our recording with the Esculap exoscope, we combined the exoscope and the endoscope, but the exoscope format, yesterday when Hira told me that we would be talking, we tried to get the exoscope format, and since it was in 3D, there was some problem with the recording format, but fortunately, we could innovate again, and there was a lot of neurosurgeons watching it. They had recorded it on phone, so we had to combine all those phone recordings together so that you get an idea of what we did. So that was the DTI showing, that was the that was a DTI. You will see the DTI now, which shows the fibers are all back. You can see that. There's nothing here. There's all the fibers are back. You see, the brainstem is a very thin, like a saucer facing the front. So there was no way you could come from the retromastoid region or through an extreme lateral approach or anything. You couldn't. You have to come from the front. You have to come from directly here. So that was a navigation distance, which is about 13.5 centimeter. And so we are exposing, my ENT partner is exposing right now. So we've gone a little bit through the maxillary sinuses, both through the maxillary sinuses. We got this head flap. The head flap is parked. One second, I am talking double, so yeah. Sometimes you yourself can be a disturbance, you see. So that is the sella, and that's the clivus. So we are exposing that part. Skull-base surgery is not complete without endoscopy. This is something that I had not believed about 8-9 years back. But then we took up endoscopy. We started going in all the planes. So we are exposing. That's the optic now. That's the optic now. That's the sella. That's the paracella carotid and the paraclival carotid. We're using the robot holding the endoscope. You will see that in the end. We are using the exoscope as well as the endoscope. I didn't have the videos here, but then we had a CUSA. We had a tissue we wanted to test out after multiple tests on cadaver and other cases. We had a CUSA, which is made out of how can I say, the electric toothbrush. So the electric toothbrush has the piezoelectric crystal. It's the same principle as that of CUSA. It's the same thing. So we took an electric toothbrush and then we tweaked it, 3D printed the tip, and we could make a CUSA which is long enough, thin enough, and could break the tissue. Very, very small. The conventional CUSA wouldn't go in there. So I wish we had those videos, but I have with me the electrical toothbrush right now. See, this is called Oracura. This is the same thing. We put a 3D printed tip on it, a very long tip that could reach 13.5 centimeter, and a very small tip that doesn't have a suction, but will just break tumor. And we were using that in this case. So we had done trials for it. So in long tumors. So this is another part of innovation. So you can see the anatomy here. That's a sella, that's a paraclival, that's a paraclivals, that's a clivus. So this is an approach which has gone partial transmaxillary. The pterygoid root has been taken. So we're going ahead, drilling all that. And now you can see the clival dura being opened. And, you know, when we are opening the clival dura, you can see the vessels right down there. So that's, I have to lift up the dura, and the clival dura is got the basilar plexus. So you have to lift up. See, that's the vessels there. Those are the vessels. That's a vertebral. And below I have the sixth nerve. That's the two vertebrals. And I have to lift up under high magnification. I have to lift up the clival dura, and I have to coagulate it because you can't. So that's the sixth nerve there. And you have to lift up the clival dura. Each time you have to open because the vessels are right onto that. So you have to use a curved bipolar and go in, lift up the clival dura, and then slowly, this is how we were removing the tumor, very small pituitary forceps and biting between the sectors, keeping all the perforators intact. It's under very high magnification. So you can see the sixth nerve now. That is the vertebral. Basilar is my limit of the exposure. This is a tumor. This side, you can see the sixth nerve now. You can see the word, and the basilar is here. So we have gone into the tumor. We've gone. So you are at the pons. This is the medulla. So you can see now, that's a vertebral, that's a basilar, that's a tumor, and there are perforators. So now, one second. I should be able to. Yeah, this is a perforator. This is the basilar, this is a perforator, and that's a tumors. That's a tumor, that's tumor. So we went ahead and removed all those tumors between these perforators. You can see the sixth nerve there. We don't think such kind of tumor has been ever done. So you can see the basilar perforator there, and you can see the basilar, you can see the words, you can see these tumors. So we used all these tools at our disposal because the normal suctions, the normal QSA could not take this out. We had to open the Gulfar segment of the cavernous sinus because we had to get access here. And that's one of the most vascular portions, even when I operate open from outside or open from inside, that's one of the most vascular portions. And then there is a C4, C5 carotid junction is there. The meningo-hypophyseal trunk comes from there, divides into the inferior hypophyseal and the artery of Casenario and Bernasconi there. So you got to be very, very careful. It's at a depth of almost 13.5, and you got a very, very narrow corridor through your nose. So you got to keep your instruments rock steady. One small mistake, if your suction goes and touches this words or basilar or one of the perforators, the result can be very bad. So we took a lot of time. We were very relaxed, and we went ahead and took it. So you can see the post-op scans. Now you can see starting from here, you will see it's exactly where the tumor is, and you will see the medulla is okay. And now you can start seeing the tumor, and this is the blood. So in the tumor cavity, this is the fat, this is the root which we have gone through, and you can see how the blood is filling the cavity. We have gone through a very narrow corridor here because the basilar was here, taken out all this tumor. And this is the endoscopic robotic holding arm that we used. This arm, what it does is, I'll show you. We designed this arm from an industrial robot called the Franca Amica, because there's no endoscopic holding arm like this available in the world right now. So because we had a poinsettia arm, which was designed by Mitaka, it's a pneumatic arm. So the moment you release the arm, what happens is the arm just drops. But this one has got torque motors. So you keep this Charlie Teo, another fantastic surgeon from Australia. So you can see how the arm is holding the robot, and you are able. My NT partner is able to operate with both his hands. It's the arm. This arm, we have to get a better drape for it, of course. But this is the arm, and it can hold the scope in the way you want, can make changes we have. And so this is the anatomy. We just got it from the sketch fab. And this is the anatomy. So that is the carotids, and that's the corridor you get. That is the two words. That's the basilars, and that's a basilar, and those are perforators there. And this is the corridor through which we took out this tumor. That's a sixth nerve coming up, and these are these perforators there. So you got this millimeter corridors, and that's how we took out this tumor. Again, if you go, you can see the transmaxillary approach where the pterygoid root is still there, but then we have taken that out, and that is the basilar, and that's the carotid. And you see the perforators. You can see the perforators there, and that's the carotid. That's a cavernous horizontal C4 segment. That's a sella. So you have to go through these small sectors and take out the tumor under very high magnification. So people thought this was inoperable. So that's an exoscope. This is for the initial exposure. And well, so we have a lot of young neurosurgeons who are watching. So innovation means just not that you're doing research or you're writing papers. Innovation also means that your mind is your biggest lab. So you have to break out of all the things that people have told you before. It means that you have to break out of all the things that you've heard before, your beliefs, and you have to do things which nobody else has ever done, because you're able to do it. You must have the skills, you must have the team, you must have the kind of infrastructure. You must build the infrastructure which is necessary, which may be the innovation. So thank you very much.
Thank you, Professor Jerry.
May I just say, exceptional presentation as always. Hi, Yoko. Hi. I was just saying to Ipe, I've not seen him in a long time. That was just a tremendous case presentation. Thank you, Ipe. Good to see you.
Thank you, Salim. Thank you very much. Good to see you too. And good to see all of you.
It was excellent picture. Oh, the Hira and holding the is it second daughter? Second daughter or son?
Hira.
Mute.
Daughter. My first.
First. Second.
Yes.
Anyway, congratulations. Conversation. Your inspiring talk was very nice. Thank you very much. So they will follow you. Thank you.
Thank you. Our next presenter is Dr. Andrea Otis from Ecuador. She is a fourth-year resident in neurosurgery and fifth-year resident in neurosurgery, researcher of Brookdale University Hospital. She's also a mother of two, so she would like to share her experiences in her journey of neurosurgery. Andrea, please.
Hi, everybody. I'm very happy to be part of this symposium, and I'm honored to talk about the challenges in neurosurgery training as a woman and as a mom as well. So I'll share a short presentation. Let's see. Please let me know if you can see it. Okay.
Yes, we can see.
Thank you. Okay, so there is increasing global attention to an awareness of gender discrimination in the workplace across several industries, including healthcare. Ecuador, it's a country in northwestern South America. We have a population of 17.764 million population, and we are very few women in the neurosurgery field. So where does Ecuador stand in terms of women in neurosurgery? So we have very few neurosurgery training programs with very few spots. Most of the neurosurgeons working nowadays, they have trained abroad. They come from Mexico, Brazil, Spain, Germany, Chile, Argentina, and Cuba. We had before a different kind of training, which was hospital-based, and it was training by experience. So after a certain amount of years, they became neurosurgeons by experience. No? There was not university-related. It came afterwards. And then we had, in the past, another university and hospital-based training where only one woman was trained. Among all these years, they stopped the program. And in 2016, again, a university started a new program. So in the whole country, they opened a new program. And you can see here, I don't know if you can see my pointer. In 2016, only 2 women among 8 men were trained. 2017, which is the year I belong to, I'm the only woman in my program. And then you can see it has been reduced the number of women in this field. We don't know exactly why, but we know that women usually are not interested in this field because of long training years and very, very, very hard experience in terms of family time and like having a balanced life. There is still much room to improve parity. I'm going to talk a little bit about my path. I graduated from high school in 2007. Then I started medicine. In 2013, I graduated. I did 1 year of social service. And then I was kind of confused because I knew neurosurgery was my dream. However, I didn't know where to train because in my country, the program was closed for several years. So I was thinking maybe Argentina, maybe Spain. And I would like to highlight this special time of my life because I know many students are watching this symposium. And it's important to know that pursuing our dreams, no matter what, it's our goal. So no matter where, if you get to have whatever your dream is, you should keep pursuing it. So in 2015 and 2016, I completed the USMLE steps. I got my US license. However, neurosurgery in US sometimes is very competitive. And if you want to have like a family time, sometimes it's very challenging. So due to some family issues and economical issues as well, I decided to come back to Ecuador to apply for the program that has recently started. So on this period of time, I realized the importance of studying because you have to take an exam, the importance of research experience, and also to get related in a neurosurgery field, to train, to shadow, to have mentors that you have mentioned so much on this symposium. The importance of that. So after getting all that information and to be surrounded by many mentors, I decided to apply, and I got into this into one of the 4 spots that was open by then. In 2020, I got married, and in 2021, I became a mom. So this made my training kind of challenging. However, it was a nice experience, and I got all the support by my program. There was no other woman in my program, especially my year, that had been through this stat. So it was challenging for the hospital policies as well, because there was nothing established. But even though it was new for them, they decided to support my time during my pregnancy and my residency training. Despite advances in issues related to gender equity, barriers to recruiting and retaining women in neurosurgery continue to exist. In USA, only 1 in 20 neurosurgeons is a woman. So it's very, it's something that you came to know. WINS, which is an ANS chapter, has established some goals, which I would like to highlight. To educate, inspire, and encourage women neurosurgeons, to enhance and facilitate interaction among women surgeons throughout the world, to foster an environment supportive of personal values and individual diversity, to improve the representation of women in neurosurgery in organized medicine and specifically in neurosurgery. Here, I share a couple of pictures with one of my mentors. She's one of my boss in Quito in the hospital. She's from Italy, but she's the one that has encouraged me to be the best and tries always to support all my path in this career. WINS strategies are applied in my program. I can share here another picture where I had to present a poster at an international congress, an international meeting, and I had to be with my baby. So sometimes we have to share these two phases of the career, and it's important to give the importance of both of them. So WINS strategies are to characterize the barriers, to identify and eliminate discriminatory practices when recruiting medical students, training residents, and hiring and promoting of neurosurgeons. Promote women into leadership positions within organized neurosurgery, and foster the development of female neurosurgeon role models by training and promoting competent female trainees and surgeons. So this is very important, and I know they are applied in my program as well. How to get a balanced life. Lifestyle considerations are a major concern to both genders when choosing a career. To pursue a balanced life is always a challenge for neurosurgeons. Time for family and friends, hobbies, relaxation, mental health, and self-care. For women, potential discriminatory practices, lack of mentors, and childbearing must be added to the list of obstacles, but it's possible. Pregnancy and residency is also a very hot topic. Not all pregnancies may be trouble-free, and not all may occur at the most convenient time. Here I share a picture when I was 34 weeks pregnancy, and I got a high-risk pregnancy due to high blood pressure, so it was not very easy. I had to be off training about 3 months. So I was feeling at the beginning that I may lose the track of my practice. However, I came to overcome this time, and I could step up and continue my training with no issues. I will cite Robert Spessler's words in 2011 when he says, "Competent woman with a passion for neurosurgery will find a way to manage both children and career just as men do, and should be assumed to be able to negotiate this issue in the privacy of their lives and just as men do. Childbearing and parenting is not incompatible with a successful career in neurosurgery. Hospital policies, supportive tutors, helping partner, loving parents, caring colleagues made a really difference in my experience, and I'm really thankful for that. I am very lucky in many senses because I know my peers and my attendings respect me and trust me as a physician. I don't see any gender inequity on my programs. I'm happy to share that. Take-home messages. Neurosurgery is an inherently demanding field. This aspect of the discipline cannot be changed to attract or accommodate any unrepresented group unwilling to do the work to master and advance the field. The road to becoming successful neurosurgery is long with many barriers for any candidate to overcome, no matter if it's women or men. The years of training are daunting and necessarily uncompromising. Passion for the field is required to stay up the course. Furthermore, practitioners must be devoted to lifelong learning. Thank you very much. Hope you enjoy this.
Thank you, Andrea. That was a great talk, especially for those who are joining neurosurgery as mothers. Professor Kato, would you like to comment anything?
Yes.
On the talk?
My congratulations on your great talk. I think you are a great mother, and also the medical students, and also that you are enthusiasm to learn a lot the neurosurgery in the future. So we all support for your the future career. Thank you very much. Congratulations.
Thank you so much. Dr. Ibe, do we have you? Yeah, sure, Nicole, please.
ごめんなさい。一人ですね、6階に今いらっしゃる方で、西脇飛鳥さんという方なんですけど、西脇飛鳥さん、いいですね。西脇、はい、西脇。
Thank you very much for all your kind comments.
Dr. Ibe Cherian, is he here still? Because he wanted to share the post-operative video of the patient he just showed us. Dr. Ibe, are you here?
Yeah, sorry, Hira, could you just share that video for a second, because there's nothing complete without a post-op video, because if I showed all that thing, everything fancy, and then the patient is not doing well, so there's absolutely no point. So we just wanted to share with all the permissions we could. The patient only had a mild sixth paresis, and she already had quadriparesis, which improved, as well as she had 9/10 palsy, which also improved. So just wanted to tell that to you. And I was hearing Andrea's talk.
I'm trying to share because I'm from my phone, actually.
It's all right. Anytime. So you can even send it to anybody who asks.
Oh yes, that. I can do that. Otherwise, yes, because right now I'm not even sure if I'm sharing. Nicole, am I sharing my screen?
No, not yet. But you you can do that anytime. There's no need to hurry for that. But I waited because I could show that video, but then I heard Andrea's talk. It's almost, I couldn't have imagined, I can understand how difficult it is for women to be in neurosurgery. Of course, my mentor and my teacher, Dr. Yoko Kato, I have seen her for so many years, working tirelessly, to improve the education and, how she used to take care of us when we were in Japan. I remember that. So that was almost 15 years back. So my best regards to all of you, and Salim for organizing this. And thank you, Hira. Thank you very much.
Thank you so much. Our next participant is Dr. Ann Mansoor. Ann Mansoor from Do we have Dr. N? She is an undergraduate and MD degree at the University of Toronto Neurosurgical resident from 2018 and the recipient of cerebrovascular research grant. She's currently doing her PhD. Anne, could you please start your talk?
Yes, hello, can you hear me?
Yes, we can.
Perfect, I'll just share my screen. Okay. Can you see my screen? Perfect. Thank you so much. I just wanted to say, first of all, thank you very much, Professor Cato and here and Nicole for inviting me to speak at this event. As you all know from the introduction, my name is Anne. I'm a fourth-year neurosurgery resident at the University of Toronto, and I'm currently also doing my PhD here in Toronto, looking at cerebrovascular biology and targeted therapies. I wanted to take this opportunity to speak a little bit about the challenges in neurosurgical residency and beyond, with a focus on female neurosurgery practice in Canada. So just piggyback on the previous presentation. And I've been in the shoes of medical students not that long ago, and I've sat on many of these webinars before. So I find these very valuable for learning, and I'm glad I can pay it back in the capacity of a resident. So just so that you're aware of what the Canadian educational process is so essentially for most provinces, students will go and finish high school first at the age of 18, roughly. And unlike many other countries, we do a 3 to 4 year undergraduate studies of, can be in all kinds of specialties before we enter medical school. And then medical school is about 4 years, and some universities 3. And then ultimately we undergo direct entry into neurosurgery. So we don't have a year of general surgery practice as in other countries, but the neurosurgical residency program in Canada is 6 years long, after which there's an expectation of either proceeding into practice, or many of us will do advanced fellowship degrees both in Canada as well as abroad. In some instances, there are opportunities, like in Quebec, to go directly from high school to medical school. And so there are unique challenges and benefits from that model, especially as it pertains to women. So when we think of the process of getting into neurosurgery in the Canadian practice, it really stems back from all the way from high school, because if we were to do an undergraduate career, we have to have some degree of an interest in science before we even get to medical school. So trying to get young students interested in science and biology and physics and maths, and as it pertains to medicine, I don't think is particularly challenging these days. And I've kind of shown a general picture here of young girls kind of learning about science. But in the past, I do remember it being more of a male dominated interest. So luckily now we're trying to garner more and more interest from the high school students to develop that passion and that inquisitive mind. And then in undergraduate career, we can do a variety of different specialties or focuses. So I did mine in biology and physiology, but there's also a time where people can seek out opportunities to shadow clinical experiences, or go to the hospital and see some cases, or participate in research. So in centers like in Toronto, we're very fortunate that these opportunities are always around, and it's just a matter of trying to take them in front of you. But in some more rural areas of Canada, it becomes quite challenging to have that kind of exposure. I don't think at the undergraduate level necessarily there's a discrepancy between men and women, at least not from the experience that I had. But perhaps in the more rural parts of Canada, that can be an issue, as students have to leave and maybe go travel somewhere to have more advanced training. And so leaving behind a family, for example, might be challenging. At a medical school level, we have to have subspecialty exposure. So all of the medical students, at least in Toronto, for example, will do general surgery, and then we're supposed to do one specialty elective. So you have to choose to do the neurosurgery elective. It's not an implied exposure. And so that becomes an idea of you have to have that interest or that exposure ahead of time to even know that you want to explore neurosurgery. And, that might come from either your high school or undergraduate days of being exposed to clinical practice or to research. In my instance, I had, unfortunately, a very close family relative of mine who had a subarachnoid hemorrhage when I was in high school. And so that got me very interested in researching the cognitive outcomes in subarachnoid hemorrhage and kind of pulled me closer and closer to the clinical side of neurosurgery. It is the exposure, and then comes with that are the societal expectations. And, it's been touched upon about culture and society. It's not something one can ignore, but being mindful of that will help medical students to push beyond the expectation. So, for example, why don't you go into, something like family medicine or pediatrics? And I've shown a picture here of a woman with a child, or dermatology or psychiatry or obstetrics. And these were the types of specialties that were very female dominant. Being mindful of the
recording in
level,
progress.
especially in Canada, because there are multiple stages before you get into training. And so people are asked to decide their specialty at the age of 22, 23, and kind of make a decision of what they want their lives to look like. And so that's a very daunting task for anybody. And part and parcel of identifying that is finding, what is it that you value, and trying to see if your values are emulated and shown in mentors that are either a few steps ahead of you, like in residency, or farther along, such as staff. And so if you can't find a mentor that kind of emulates what you want, it can be very hard to imagine yourself in that field. And I think for females in neurosurgery, that was the case, especially when I was training in medical school. In Canada, unfortunately, in Toronto, there still are only two female neurosurgery staff in the University of Toronto, which has 4 large academic hospitals. And so I found that to be very surprising, and trying to find female mentors as a medical student was a bit challenging when I first started out. And so it was a bit hard to imagine a work-life balance or an idea of a future when you couldn't see somebody emulating that. And so I developed, and I was the first president of the Women in Medicine group at the University of Toronto, trying to match women from all kinds of areas of interest with females in their specialty, to try to show them that a different vision of your quality of life, or certain specific nuances that you might be looking for, can be achieved whether you're a woman or a man. And lastly are the things, as I mentioned, shadowing and experience exposure. Now, the direct entry training makes things a bit harder for us, because if you do a year or two in general surgery, you might kind of understand what the challenges are of surgery in general, and you may understand whether you would like it, or say, no, I don't like it and want to pursue something else. But in Canada, we have to start on neurosurgery immediately right after medical school. And so it really stresses the importance of having appropriate mentors to kind of show you that the challenges you might be having as a first-year resident are not permanent, and they're not the same challenges that maybe a first-year staff is having. So trying to have mentors at various different stages of the career really helps to put the experience in perspective, and to kind of understand whether or not this is the appropriate subspecialty for you. And so I show here some pictures, and you see a picture of myself with a female neurosurgery resident. Her name was Teresa. She was one of my greatest mentors in the program. So Teresa is now currently a staff in the community. But when I was that picture was taken, I was a second-year resident, and she was my chief resident. And Teresa and her husband, Jamie, they were both neurosurgery residents at the same time in our program. And they had 3 kids rather, during her PhD time. And they also she started up a baby food company that is now all around North America. And she did this all during her PhD time, alongside being a mother and a resident. And to me, I thought, wow, that's a super mom. And so I thought it was very interesting that I was very appreciative that I had that kind of mentor. And she's a lovely person who likes to do a lot of things outside of medicine as well. And so I was fortunate that while there weren't too many females in the department at that point in time, at least the people that were there were phenomenal and took an interest in showing the multifaceted aspects of their lives. And so that's a picture of us as we were giving a radio session about women in neurosurgery. And to the left of that, you see a picture of Dr. Delaray-Zadeh with her two babies, her baby and her daughter. So Dr. Zadeh is the first female chairperson of our department, and she is quite prominent in various neuro-oncology fields around the world. And her second daughter, she actually had very recently, I think about a year and a half ago. So even as she became chairperson, she did so being pregnant. And so that was very inspiring for many females in the field. And she was one of the female neurosurgery staff, one of two that are in Toronto that were inspiring for us. And aside from having mentors, another thing that's important when you're a resident is to feel the same appreciation and value as a man or a male resident would have. And so, being able to have that success story of, taking out your first tumor, and that's a picture of myself there with Dr. Sunit Das taking out my first MET, there's a sense of accomplishment in that. And so I think it's important for all residents to have their accomplishments be recognized and have a sense of value in the team. And so we all have different strengths, and sometimes women do have various different kinds of strengths compared to men. And so recognizing those strengths and kind of showing that you do have a value in the team, it really helps to put your efforts into perspective. And alongside with that comes the idea of promotion. And so I was fortunate that during my residency, people saw my potential and promoted me to various opportunities. I had the opportunity to be promoted to being an editorial review board for one of the journals, or kind of being asked to sit on various committees for health policy or health curriculum and leadership. And so sometimes, you can be a very ambitious person and seek out opportunities yourself, but it really helps when people see the value in you and try to encourage you to seek opportunities that are at higher level and ones that will advance your career. And so, and that particularly becomes important for women as they may be balancing other aspects and juggling, personal elements in their lives that they might think that their career needs to take a bit of a back seat. But if anything, opportunities for promotion should be offered more and more, and kind of help to ignite that fire again in your interest. And those goals in life, both professional and personal, are quite fluid. So the person I was and the interests that I had when I was a medical student or when I was a first-year resident are very different than right now, and that's completely okay. I'm a first year in my PhD practice, and PhD life is extremely different than clinical life. And so there aspects of myself that I've learned this past year, things that I learned that I like to do outside of medicine, and aspects of my personal life. So while I'm not married and I don't have kids yet, these are now things that are popping into my mind of things I want to have in the near future. And so, it's normal to have your goals be fluid over time, and it's important to have people in your personal life as well as your professional life to be able to support and meet those needs as they progress in your life. And lastly is the issues of attrition. So in residency, we always want to get to the next step. Every program will have some people who may leave the program or seek other opportunities. And part of that might be just an element of dissatisfaction. But when we look at women, for example, they're in Quebec, they have the highest number of female neurosurgeons and lowest amount of female neurosurgery attrition. So part of that is just they have way more mentors, so people can see that their lives are amenable to that. And the second aspect is for them, they go directly from high school to medicine. And so, doing neurosurgery a little bit later on in your life, in terms of your age group, might present different challenges as work-life balance or personal elements of your life come in. So these are things to keep in mind. Lastly is global neurosurgery, and I've been very fortunate to have exposure to that, and trying to see what other people around the world do, how they do things in neurosurgery, not only opens your minds and gives you opportunities for learning and collaboration, but it also helps to understand that we're all kind of the same. All residents face similar needs and challenges in terms of, wanting to have a promotion in their work life, work as well as having fun in their social life. But it also shows that there are maybe specific societal and cultural differences that place a burden on whether certain, surgical advances or techniques are made. And so that helped me in terms of figuring out how can I bring a certain technique to another part of the world. Maybe a certain element of their culture needs to be addressed or implemented or encouraged to allow for a technique to be advanced. So I do encourage people to incorporate global neurosurgery as well, even as a female. So the and beyond part, I spoke a lot about it as a neurosurgery resident and as a PhD student, as somebody who is interested in academic practice and the challenges that come in being academic medicine and neurosurgery. We kind of formalized this for the and beyond. So this is the thought process. We did a survey for all female staff neurosurgery attendants across Canada, looking at both their perceived barriers as well as their thoughts of what made them successful. So this was sent to all the faculty and had both quantitative and qualitative responses. So out of the 31 female neurosurgery staff across Canada, we had about a 60% completion rate. So in looking at the factors that they felt were supportive and enabled them to have success in their careers and these are things that have been mentioned before. And interestingly, the similar things that have been mentioned for the medical student and resident level. So the same themes permeate through. And that's the idea of having supportive colleagues and a supportive work environment for both the professional needs as well as your fluid personal needs in life. And having the sense of academic accomplishments, whether it's having good success at your cases, but maybe also looking at advanced careers. So having whether you want to do an MBA or you want to do a master's, or like myself, you want to pursue a PhD. And the other element is having advanced fellowship training was really helpful for them. And perceived barriers were inequalities to career advancement opportunities. So having more advancement opportunities for promotion, either in private practice or for elevating in terms of academic practice, more opportunities were provided for men with higher pay. Conflicting professional and personal interests. And that's unfortunately something that has been brought up time and time again. And the most important thing, in my opinion, is lack of mentorship. And interestingly enough, when we look at lack of mentorship, more has been the issue with lack of female mentorship for female staff. So next steps, I think, in terms of what we can do in Canada, and I think this also applies to other parts of the world, is improving the mentorship. So the more numbers we have, the more diversity can be provided in terms of what does a female in neurosurgery look like, because it can really look like anything. And having that ongoing relationship with mentors at various stages of your life. Putting an increased value on professional and personal life balance, and that's okay to want to have a life. And I think more stress should be put upon that and allowing for that at work, and increased support for both professional development and academic advancement opportunities. And lastly, I think is the idea of promotion for global exposures, to open your mind and to develop a larger female network, and something as simple as equal pay. But thank you so much for the time and for inviting me to share my experience. I hope that was helpful.
That was great, Anne. Thank you so much. I'm sure it's good to see the perspective from the West as well, and you just portrayed it really well. We would like to
here can I say, here, may I say a word here just for Dr. Ortiz and Dr. Mansour. You guys represent what's really important for the future for us. My generation of leaders my generation has been different, and we've really tried to open these networks and leadership positions for female neurosurgeons. So you have the responsibility as well as residents to mentor the next generation. And if either one of you, we're holding this Congress in Granada in September, the plurality of the medical students that are coming are female students. So having mentors like you just as important as having senior neurosurgeons. So if you can contribute to that, communicate with me, we'll make sure you get on the program. I think having you guys on a program is very, very important because they relate to you more, actually. So I hope that you guys can be involved with these leadership development programs with us. Thank you so much.
Thank you.
Thank you so much. Next presenter is Dr. Afnan Al-Khotani. She's actually from Saudi, and she's currently doing her fellowship in Toronto. She did her neurosurgery internship at King Fahd Medical City, and she's currently a postgraduate year 2 in trauma and neurosurgery, senior neurosurgery resident at King Faisal Specialist Hospital and Research Center, and now is currently doing a fellowship in Toronto. I had a chance to meet her when we were in Jubail, and it was a great time. Thank you so much, Dr. Afnan, for joining us. Please, you can start now.
Hi, good morning. Sorry, good evening indeed. So, do you see my desktop?
Yes. Yes.
Sorry, I'll just go back very quickly. First of all, thank you so much, Hera, and all the organizers for inviting me to this talk today. It's a great honor to me to present at this meeting. It's the beginning of the weekend, and all of the dedicated people are still here. So I really had a rough day today in the surgeries, but I wanted to make it happen because I'm kind of representing the West countries with the East countries as well. So I'm coming from the Middle East, from Saudi Arabia. I came here to pursue my fellowship in Canada. So when Hera talked to me about the challenges in neurosurgical training, I was really trying to wrap up ideas about what to say. So I just prepared a very simple presentation in order to make things more organized and to keep my thoughts in parallel. So I just would like to start with a very brief history about the neurosurgery in Saudi Arabia that was established quite recently, before my birth. Obviously, 1983 was the presence or the return back of the very first Saudi neurosurgeon who was Germany certified. Neurosurgeon. He came back to Kingdom, and he started the neurosurgery program in the eastern province of the Saudi Arabia. After that, a lot of great neurosurgeons came back. One of them is a great mentor of mine. He's Prof. Zain Al-Abidin Jamjoom. He's a really great mentor to me. He started his journey in Riyadh, and then he moved back to Jeddah, where I am from. And then a lot of famous and brilliant neurosurgeons there. I can't really mention a name instead of others, but they're all great. One of the very, very well-known founder is Prof. Saleh Baisa, who has a fingerprint in my training. So after the great people came back to Saudi, because there was no program at that time, and they were having some scholarships to North America and Germany. So they came back and they established something called a National Scientific Association for Neurosurgery in the Kingdom. And they started to establish the Saudi Commission that investigate the certificates that are coming from outside the kingdom, and they established the program. I would also like to mention the great woman in neurosurgery. One of the very, very first neurosurgeons, Rahmatullah Alayha, Dr. Samia Al-Maymani. She was still under training in New York, but she could not complete her training because she passed away before that. Then Dr. Aisha Al-Hajjaj, she established also the neurosurgery program. She was one of the very first residents in the Saudi program. She had her fellowship done in London, Ontario, in skull base and vascular with endovascular training as well. And then Dr. Jamila Murtada, she is also specialized in pediatric neurosurgery, and she was working in a city in Saudi Arabia called Yumba. The other doctor is Dr. Ikhlas At-Tuwaijri. She is also a great pediatric neurosurgeon. She has been graduated from Ottawa, fully Canadian training, and specialized in pediatric neurosurgery and currently working in Riyadh. And also proudly in Jeddah city, which is my city, we have Dr. Sual Omar. She was trained in Toronto Western Hospital during her residency, and then she got her fellowship in functional and epilepsy from Cleveland Clinic in United States. Also Dr. Tagreed Al-Sinani. She is a brilliant neurosurgeon in Jeddah. She is running the trauma center in King Fahd Hospital, the best trauma center in Jeddah. Also, Dr. Amal Al-Yahya, she has completed her Saudi training in residency, and then she moved to Canada, and she had extra fellowship also in Europe for pediatric epilepsy neurosurgery. This is a simple distribution just for the Saudi map to distribute the number of females neurosurgeons in comparison to males neurosurgeons in Saudi Arabia. Actually, I was preparing this map in 2019. The latest update was early 2020. So I don't have like the real number for now. I'm pretty sure like the numbers are going high crazy, but this is the latest update from my side. It was before I leave for my fellowship. Also in Saudi Arabia, we're hosting the Saudi Association of Neurosurgery, which is an annual meeting. We also came up with the idea of the Saudi Young Neurosurgery Group, which is a final meeting. The very first founder was one of my greatest colleagues, Dr. Dima Sehli. She came up with the idea, and suddenly the dream came true. So we also currently, beside the neurosurgical, very well-established residency program that is running in different cities in Saudi Arabia, and Jeddah, Mecca, Medina, Riyadh, and Eastern Province, as well as Abha city in the southern region. We do have also a couple of fellowships programs. They are just starting. The Pediatric Neurosurgery Fellowship was very well started many years ago, but the skull base and the spine neurosurgery fellowships, they are pretty new over the last 2 to 3 years. So, as I said before, the Saudi Young Neurosurgery Group was also funding many young neurosurgeons around the world to attend many of the workshops and meetings. Currently, we have the scholarships diverted mainly to the fellowship programs for the training. I had my fellowship, my scholarship in functional and epilepsy neurosurgery. And also we have a lot of women empowerment program running in Saudi Arabia. One of the greatest program is currently the MISC program, which is Mohammed bin Salman training program for the young high school students that needs mentorship in their life. This is a thing that I wish if I had when I was at high school to be mentored by greatest and successful role model in my life. So I'm very happy that I'm giving this to the younger generation. On the other hand, when I arrived to Canada, I've met great people. Two of them are great neurosurgeons. Like it was a real honor to work hand to hand with them. One of them, I think Anne Mansouri has mentioned her name previously, and her picture with her two daughters, Dr. Gallery Zadeh. She is the chairperson of the whole department. She is the kindest and the unique person. She made the department really proud of her. The other person is my direct mentor in functional neurosurgery. She's a truly role model to me, Dr. Mojigan Hudai, a great person to work with. I'm super proud of her. I'm so happy to be one of her fellows. Like, she's a great mentor of mine. What I want to tell the younger generation about neurosurgery training is that the journey starts very early, since like medical students find your interest. As an intern, try to find to work on your passion, expose yourself to the department, go and explore as much as you can. During neurosurgical residency, I'm not gonna lie, it's tough. It is a tough residency. It's a tough part of your life, but enjoy every moment of it. Like, it will teach you a lot of stuff. Like, resilience, I think, is the most important part about it, because like long on calls, long procedures, but I'm pretty sure that stamina will be built up during your journey. So don't worry about lacking behind. You will get a lot of experience, and you will build up a lot of stamina. Also, there are some ideas. Maybe in our part of the world, we don't have this philosophy of doing a master degree or PhD during our residency. But when I came here to Toronto Western, like, I found a lot of my colleagues from the residents, they had freeze part of their residency where they did their PhD, and they established their life, and then they come back to practice the clinical neurosurgery again. So it's an idea that we can consider to fulfill our like personal and social requirements. Then the neurosurgical fellowship, like it was also a tough part of my life. Why is that? It was because I moved to Canada for my fellowship during COVID time. And during COVID time, my husband is a doctor too, and he couldn't take a leave to come with me. And also traveling with a baby, it was so difficult. And also bringing my mom to stay with me during my fellowship, it was like a great risk for her, like exposing her to long time traveling distance. And during the pandemic, it was so difficult. So I'm still happy about my fellowship and about the rewards. I'm almost finishing and wrapping up now, but like, it is a challenge to leave your country, to leave all of your beautiful life behind and come to study and pursue your dream. And I'm really thankful for that opportunity. I'm looking forward to become a junior consultant after 1 month from now, starting in July. I'm pretty sure I'm facing new challenges. I'm not gonna lie, I have a lot of anxious thoughts about how am I gonna start, but I think it is the process. Like, whenever you move into a certain grade or degree in your life, you have the same degree of anxiety and wishful thoughts about how it's gonna be. But I'm pretty sure that I've done my best, and I might ask you, like, really just pray for me. Senior consultant level is the level where you become really comfortable about what you're doing, and I think commitments and hard work would pay off. I'm looking also to be like the professor by a certain stage of my neurosurgical journey, mentoring younger colleagues, and give them the things that I was in need at certain stage of my life. I would love to talk about every single moment on those pictures. They are a bit impacted, but like, I'm just giving advice to every single one of you here. During that journey of neurosurgery, don't forget about your happiness, and life become brighter with a partner who's taking care of you, who's like standing in your back. And And every success you would love to share it with someone who really cares about your success in life. Also, like making friends and enjoying your long hours of operating. A lot of mentors, like I had a lot of great mentors. Like a lot of my mentors were men, and I'm proudly saying that they were great people who stand with my back, and they were like a backbone to me. Also, like I don't know, like I started my presentation like this. I collected about couple of stuff. One of the most important thing to me was having this I'm not gonna say a uniqueness, but it's a kind of an element that makes maybe females in neurosurgery more unique about it, which is compassion. Like working with a compassion has been proven to be like superior on the patient's outcome. So being a mom, being a devoted person, and even like compassionate and very hard worker would pay off. I'm pretty sure that there are a lot of us has experienced burnout at a certain point of our life, but what gets us back is the resilience and the self-satisfaction when you do your work on the highest ever standards. Finally, what I want to tell every one of you is that follow your dream. Like I started my residency, started to read from human book, and the name that I saw in functional neurosurgery, like the whole chapter was written by Prof. Lozano, and I was reading his name on almost all the papers that came to my hand from functional neurosurgery. Functional neurosurgery was always a dream of mine, and Lozano was like the highest farthest ever person that I would ever imagine myself working hand to hand with him. And luckily, I've met him once, one time at a conference, and I took a picture, and I was like, it's a dream, but like a very remote one. So I'm very proud that today I've been trained by his supervision directly, and I shared with him some papers, and one of those like upper left picture, an operation with him doing a stem cell implantation, transplantation, and the one on the right was with him after implantation of fornicel DBS for a patient with Alzheimer's disease, and the one on the lower picture is with Dr. Taufik Valienti. It was on the purple day of epilepsy, and we were celebrating that day after a long surgery and then a long clinic. So I think neurosurgery is a beautiful journey. You just enjoy every moment and all the steps. You don't look at it as a destination. Enjoy every moment, and don't forget yourself and your family while you're under training. Thank you so much, and I hope you enjoy it. Thank you.
Thank you so much, Dr. Afnan. It's wonderful to have your experience with us, both from Saudi and from Canada. I would like to invite the next speaker, Dr. Abdul Basit Ansari. He's resident at Civil Hospital in Karachi and working currently in the Department of Neurosurgery, which is associated with Dow University of Health Sciences. He is representing the challenges.
212番の方どうぞ。
Abdul Basit, can I please have you on screen, please?
Assalamu alaikum. Can everybody see and listen now?
Yes.
Can everyone see my screen with the presentation?
Yes, Abdul Basit, we can see your screen.
Assalamu alaikum. My name is Dr. Abdul Basit Ansari. I am neurosurgery resident from Trauma Center, Civil Hospital, Karachi, and I am going to speak on the topic of neurosurgical challenges in the training and beyond.
Can I request Professor Kato is your speaker? Yes, thank you so much. Thank you. Yes, Abdul Basit.
Thank you. This is a trauma center. This is the biggest tertiary care hospital in Karachi where I work, and it is the busiest hospital currently in Karachi. And a lot of patients came all from the Karachi with complaint with trauma and all other surgical issues. For neurosurgery, all about neurosurgery is we understand that neurosurgery, all the residents or medical students, neurosurgery is all about passion. Everyone in this field came from with the passion in their heart of neurosurgery because we understand that it is a hard field, it is a challenging field and demanding field, very long working hours. And after long working hours, the only thing which kept going is the our passion, and everyone in this field uh, follows their dream. And the basic road to neurosurgical residency in Pakistan starts from the medical school. In Pakistan, we have 5 years of medical school followed by 1 year of internship. And in this internship, most of the students or medical students decide which field they will go to. And for me, it is the neurosurgical internship. And after that, I decided to go into neurosurgery. And in this 3 months rotation, I have scrubbed in many neurosurgical trauma surgeries. And after getting seeing my patients getting recovered, this gave me passion for the neurosurgery. And after that, the next part in the training is the our exam, the entry exam, which is called FCPS Part 1. And the FCPS exam is the entry exam for the residency system in the Pakistan, and it is guided by the CPSP, the organization body which conduct this exam. And after that, after the induction in the surgical system, there is a 2-year general surgery for and followed by a 3-year specialty. And for in Pakistan, we can decide during the general surgery that where we want to go. And most of the students or residents decide in this period of 2-year general surgery. And after general surgery, you have to give an exam and then start the neurosurgical training. And after the neurosurgical training is around 3 years. Some institutions advise 3.5 or 4-year training. And after the 5-year training completed, we have to give the exit exam, that is the FCPS Part 2 exam. And after that, we can conduct surgeries independently as an independent young neurosurgical consultant. For a neurosurgical resident, 3 bodies decide the training program. That is the College of Physician and Surgeon in Pakistan, the Pakistan Medical Council, and the medical college and affiliated hospitals. We understand that the neurosurgery is all about supervision and mentorship. So the College of Physician and Surgeon of Pakistan provide us a mentor to every resident so that he can take guidance during surgery and hopefully beyond. And rest of the story depends on the licensing exam, the medical college, and his exams. The biggest hurdle in Pakistan and to acquire in the neurosurgery training is getting a neurosurgery residency, because there are very few hospitals which provide dedicated neurosurgical training. And in Karachi, the biggest city in Pakistan, we have 4 hospitals with neurosurgical training program. And every year they induct 2 to 4 neurosurgery residents. That's why it is very difficult for a lot of students to get into neurosurgical training. And some students opt to repeat the exams or stay for some time to get to secure a neurosurgical training. Also, another problem in this is there is no centralized induction system. That is, every institute or every hospital has a different system for inducting their residents. And if you are trying to get training, then you must apply to every different hospital, if not all the hospitals, to get the residency job. After getting into the residency, the next difficulties can be acquired are the neurosurgical structure and where you are working. So the basic structure consists of the neurosurgical ethics, knowledge, and skills. So it may vary according to the institution you are working. In Pakistan, the government-based institutions, there are the government-based institutions and private institutions. Since the government institutions in Pakistan are completely free of cost, so a lot of patients come to government institutes, and there is overwhelming flow of patients. And sometimes we have to decide or triage the resources for the patients according to the severity of the disease. And sometimes you have to decide not to go for surgery or go for any management because the unavailability of the beds or ICUs or other facilities. Also, some institutions don't have the proper neurosurgical facilities or agents like neuronavigation, microscope, other things. Luckily, the program where I am getting my residency, the trauma center, it has all the recent advancements of the neurosurgery. So I am getting the best of neurosurgical training here. Also, another problem in the neurosurgery is the advisor or the supervisor or your mentor, because your training depends on your mentor or the supervisor, and a lot of good mentors are available in Karachi. Dr. Salman Sharif, he is guiding a lot of young students and residents, and in Aga Khan Hospital, Dr. Athar Inam, he is one of the leading neurosurgeons in Karachi, and he is always available for guidance and advice. Another part of the neurosurgical residency is the research, and we understand that neurosurgery is a research-based faculty, and all the decisions are depend on the ongoing research, and a lot of knowledge has to be discovered in the recent years because a lot of is unknown in neurosurgery. So in the government institutes, because of the overwhelming population of the patient and sometimes inability of the resources, the research part can be low, and it depends on the resident or the his mentor that the resident may produce enough articles or enough research papers for upgrading into the consultant. Also, some other issues of the neurosurgical residents are it is difficult to achieve a work-life balance. In our institute, we follow on-call system of every 4 to 6 days, and in on-call we have to stay for 24 hours, sometimes more, and it is very difficult for your physical and mental health to stay awake and continuously do surgeries back to back 24 hours. But at the end of the training, you have story, a lot of stories, a lot of success stories in which small steps you have taken result in big changes in the life of your patients. So the pleasure and the motivation came from the health of the patient that you took care. Also, the OPDs and the operation theaters depends on the consultant you follow and the hospital institutes or the place you are working. But in the end, everything depends on that the passion you have for neurosurgery and the important issue in the neurosurgical residency is the burnout. It is a true issue, and a lot of residents, sometimes up to 90% of the residents in Pakistan, face burnout. And I previously suggest think that because of the work, overwhelming work in government hospitals, we suffer burnout. But recently, I discovered that the private institutions have more burnout in residents than government setups because there is a lot of work in private institutes, but the environment of the hospital depends a lot on it. So previously I was working in Rafat National Hospital, but after 1 year of neurosurgical training, I decided to leave that because of physical mental stress on my health, and I decided to join Trauma Center Civil Hospital Karachi. So be aware of the burnout that you are facing, and sometimes you are doing everything, and you are seeing that your patients are getting better, but still you are feeling worthless or you are unable to cope with the situation. So take guidance, take help from your seniors, senior consultants, or your friends, and avoid burnout and get vacations or get leaves and spend your time with
Sorry
family.
to interrupt, Abdulwasir. We are running out of time. Can you just wrap up in a minute, please?
Okay. Another thing is research. It is very important at the neurosurgery, and the CPSR is a governing body advice at least one dissertation or 2 articles. But a lot of research work is being done in neurosurgery in Pakistan, and it depends on the availability of the resource and the research environment of the hospital. Luckily, in our hospital, there is a research department which facilitates and guides us for the research. Beyond the neurosurgical training, there are subspecialties, and at least 2 to 3 subspecialties are being conducted in neurosurgery in Pakistan. The spine workshop, the neuro-oncology workshop, the neuro-oncology subspecialty and the spine specialty is offered in Pakistan, but a lot of the specialties, subspecialties are not available. So most of the residents try to go beyond and get the fellowships there and research opportunities there. And after the COVID pandemic, a lot of knowledge and a lot of education is being done online. I am very thankful to the Dundee Society and Professor Abdul for organizing this environment, this society, and I'm associated with Dundee, Pakistan, and I would like to commit in the future events. Thank you, Dr. Hira, for inviting me and for giving me the chance to present here.
Thank you so much for highlighting the problems and the obstacles in neurosurgery residency in Pakistan. Can you, Nicole? So we have our next speaker, Warlux. Warlux just messaged that she is not able to come to join us online. So she has sent us a video recording of her presentation. We would just quickly play that, and we would conclude the session after this. Thank you so much.
Hi,
First of all, I would like to say that I'm really sorry that I cannot join today because I have like incoming case that come this evenings in Thailand. So, but I really want to join this. But however, it's been an honor for me to be invited to talk about the challenge in neurosurgical trainings and beyonds for the AMSRS and Bolivia Dani clubs, especially for the students and residents meetings. So today I would like to give a short speech, but not go through all the details about why I get into the neurosurgeries trainings and how it's difficult in every details. But I would like to give a positive and what do I think about like the training things that I think just right now it's really quite balanced for me. So my name is Dr. Valdossini. I'm currently working as a neurosurgeon, neurovascular surgeons, neuroendovascular, and I also the freelance medical illustrators, and I'm a dreamer. So in Thailand, I've trained in the medical school for 6 years, and after that, for 1 year in the externship programs, and 1 year in the internships training programs, and then I applied to do the neurosurgical training program for 5 years. I will talk about why I choose to train in neurosurgery department later. And then I come back to my hometown and practiced and working for 1 year. And after that, I decided to do more 1 year in neurovascular and endovascular fellowship training programs. And after I finished, so right now it's been 2 years and so on that I'm working as full-time neurosurgeons, neuroendovascular surgeons, and also as a medical illustrators. And I still think of further my studies. So I also do the freelance medical illustrators and graphic designs, and I also working for the neurosurgical TV teams. And I am an editorial board of International Asian Art and Culture journals. So I post some of my work, and most of the time it's more updated on the Instagram, so you can follow me with the link. So why do I choose to be neurosurgeons? I'm the type of woman that I love challenge. I don't see the difference between men and women. For me, everything that seems challenge and the difficulties, it's I always have a passion to do it. Nothing can stop me. So I believe in the power of women, especially when I heard that neurosurgeon is the most difficult board exams in Thailand, and is have tough training programs that you need to sacrifice your times, your private life, your working life balance. But I mean, after that you train, so you can be a real hero because you can save a lot of people's life, and you can see how happy the families, you can see the people's smiles and how happy the families that see their lover back again. And it's very complicated and complex. I love that. And brain is the mystery. Even now, it's human brain is so so amazing, so complicated and always mysterious that it will be never ending knowledge. So it's always updates with the technologies and knowledge that we have to keep update all the times. So why I'm training, of course, maybe on some day you will feel that, oh, you cannot handle it anymore, it's too tough for you. But I would like to encourage you that if you believe in yourself, you can do everything, because hard work does not kill you. I mean, on a day that I really feel tired, you can cry, but at the same time, you still can work too. And maybe when you pinch yourself again, you still like, oh, I'm still alive, and a new day will come eventually. And you have to know your strengths and your weak point, and work-life balance is very important. Though for me, I find some difficulties and challenge working as neurosurgeons. Of course, that I cannot deny that they have some difficulties of me working as neurosurgeons. Especially, I am the Asians. So I always mistaken by the patients or being someone else because I look young. So especially when I try to tell them about what the operations that I do, maybe sometimes they will like curious that I might know what I'm doing, and have to they ask like, you know, how experience or how many cases I have done before. So I have to show my certificates and everything to them. But I mean, at the first beginning, when I begin my career, it's quite like, you know, annoying, disturbed. But I mean, I won't take that serious because it's the nature of life. So it will, I believe that it will be working well as along the times. And maybe sometimes you will feel that you have a self-doubt or fear of being discovered as an intellectual fraud, or it can imply that imposter syndrome. I always feel that all the times, even now, but I mean, you have to keep updates and keep updated knowledge and read the books to keep yourself like, you know, in the knowledge all the times. And even you have some self-doubt that you might cannot do it, but you know that, I mean, every surgeons have the talents and abilities to do things. And my other thing is I am left-handed, so which means it's the more challenge for me that I have to try more than normal, because in Thailand there not many instruments that provide for the left-hand surgeon. So that's why, I mean, compared to my friends with right side, so maybe they only like, you know, have to practice only one time, but for me it had to be 2 or 3 times. But practice make perfect. That's still the very important. And for my main motivations to pursue these specialties in particular, I always believe that women have a great career opportunities, and women have many abilities that can be explored for the futures empowered, and women can empower others and always be inspired. So I will not say that this is the perfect field that everybody should be, but you have to know that what you really want and what is matched with your personalities and what is matched with your passions. Today, I would like to give the students or the neurosurgical training that don't lose your faith. You can do everything. Maybe someday you will feel that it's a little bit harder than other days. Maybe someday you feel cheerful. So work-life balance is very important. Thank you very much.
Thank you so much, Nicole. Thank you. Thank you, everyone. So that concludes our talk and our conference today. Thank you, Professor Kato, for your support and the opportunity, and all those who participated. Thank you so much. Sure. Yeah. Yes, sure. Sure. Yes. Sure. Thank you, everyone. Thank you. Bye. Thank you so much. Thank you. Thanks.
Yes, thank you very much. So for great effort. Salim, thank you very much.
Bye, Yako.
No, yes, I expect your leadership. Thank you very much.
Thank you for everything. We'll stay in touch.
Yeah, please.
Bye.
Thank
Bye-bye.
you. Bye.
Bye. Bye. Bye.
Mira, thank you. Bye.